conference that we've been enjoying over the last couple of days, but also their leadership in this specific area of work. And we will be really counting on Brazil to help us to move forward on some important indicators around equity and gender and the priorities of the Belém Health Action Plan. I'd also like to thank our co-lead, the Lancet Countdown team, and all the amazing work that they've been doing in this topic area over the last few years. So with that, let's move on to the next slide. So you would have seen this slide yesterday in Elena's presentation. It's an overview of the ATACH. So this task team is one of the engagement opportunities within the ATACH for ATACH members, and the task teams are centered around very specific deliverables. And of course, this task team is around indicators for climate resilient and low carbon sustainable health systems. As I mentioned, it's co-led by WHO and the Lancet Countdown, but it really relies on the contributions of many ATACH members, and that's how we'll be delivering on this important piece of work. It also contributes to, well, specifically the monitoring and tracking function of the ATACH, and also indirectly to the other functions of the ATACH. So far for the task team, we've had 2 virtual meetings, and then of course we have this great opportunity to come together in person and have this full session on monitoring and indicators. Now what you can see here on the slide, which is a lot of text, is a framework that was published in 2022 for climate resilient health systems. And we can see here that there's 3 areas that we think need measurement. So there's the upstream determinants of exposure and vulnerability, climate resilience of health systems, the functions of health systems, and then the outcomes and risks. So one of the key messages for this task team is that we're not starting from scratch. There is a lot of work that has already been done on monitoring and indicators, and we're building on that. Of course, there's the Lancet Countdown, the ONS, the Global Goal on Adaptation. WHO has done a lot of work on monitoring and indicators for many years, particularly through the Global Survey and now with the GPW 14. And particularly in climate resilience, we have quite a solid base and a lot of work done around the process. So this middle part of the diagram you can see here, which is based on the WHO operational framework for climate resilient and low carbon health systems. So we have a lot to build on there. But we also want to focus in the task team on some of the areas that are a bit less developed, so the outcomes. There's a little bit of work on some outcome and risk indicators, but there's still a lot of work to be done there. And then we also want to look at some of the upstream drivers, and as I mentioned, particularly with the Belém Health Action Plan, looking at some indicators around equity and gender and strengthening the work in that area. And today there will be the opportunity to have a discussion around indicators for the Belém Health Action Plan and how we will come up with those indicators to be able to measure progress in those 5 priority areas of the plan. And as with all ATACH task teams, they're focused on country priorities. So these are all priorities for countries. And as I mentioned, we'll be focusing on indicators for climate resilience, also indicators for low carbon sustainability, process and impact indicators. But finance has also been identified as a key priority for countries. So looking at indicators around availability, access, and cost. And this is my final slide. There is also a lot of text on this slide, but it's looking at what are our plans for the task team, what are our priorities in the run-up to COP30. So we do really want to focus on aligning indicators. So as I mentioned, there is a lot of work that has already been done. How can we better share information and align all those monitoring initiatives? We would like to do this through continuing to share information on the scope and progress made by these different initiatives, But there's also opportunities, of course, for our ATACH members and for others to participate and engage in the meetings and engage with the relevant partners who are leading these initiatives. There's the ongoing work for the Global Goal on Adaptation, and I won't talk about that a lot because we have speakers that will talk about that in a moment. There are opportunities to provide some inputs to that process. The Sharm el-Sheikh adaptation agenda is ongoing, and we would also like to make sure that we're building synergies and aligning those indicators for the priority areas of that agenda, which are resilience, early warning systems, heat action plans, finance, but also making sure that we're aligning with this process going forward to COP30 and the priorities of the Brazil leadership. And there will again be opportunities to contribute to the implementation of that agenda. And of course, what we really want to discuss today is the Belém Health Action Plan. We want to see how we can define a minimum set of indicators to measure progress on that plan. But again, building on work that is already there. And there's good opportunities for all of us to provide input to this process, including the discussion today. And then more broadly for the task team, we want to think about how we can define concepts, make sure we're speaking the same language, develop a framework and approach to advance the indicators across the different areas. And there'll be opportunities for all of us and ATACH members to contribute to the task team and to contribute to a proposal that will be provided by the task team leads. And then finally, there are other opportunities to contribute. The WHO Climate Resilient Health Systems Index has been developed and rolled out to countries, and we're working on the Low Carbon Sustainability Index. So it's been rolled out through the global survey. The results will be shared with the task team members, and there'll be opportunities for providing technical inputs around barriers and challenges and promoting the index more broadly. So I will stop there and hand back to Gladio.
Thank you so much, Marina. Amy, please. So now let me invite Marina Romanello to talk on the progress of the Health Expert Group under the Paris Agreement's UAE Belém Work Program on Indicators.
Thank you so much, Gladio, and thank you, Amy, for setting the stage so well, and thank you all for being here on the first session of the last day, so we got there. If I can have the slides, I'm going to tell you now a bit about the work that we have been doing so far in the context of the ATACH task team, but very interlinked with the work that we've been doing as part of the Global Goal on Adaptation. As Amy explained, this task team is intending to pull together knowledge, expertise on the development of relevant indicators to guide action on health and climate change, and support also standardization of indicators. We had plenty of discussions over the past few days on the importance of generating meaningful and standardized metrics so that countries know what we're monitoring, that we have common understanding of how to monitor, how best to monitor, and how to interpret the results as well. So just as a bit of background, there's a lot of ongoing processes in indicator development. You can see some of them on screen. The Global Goal on Adaptation is what I'm going to focus on mostly today. But we also obviously have, in the context of the WHO's Global Action Plan, a whole set of indicators monitoring progress towards the delivery of that action plan. We also obviously have the Belém Action Plan that we've been discussing now, and we will need to monitor and to evaluate the extent to which that is being delivered and to refine the progress of delivery. Obviously, countries have been working really intensely in their NDCs throughout the year and are also working on their vulnerability and adaptation assessments and their national adaptation plans, which incorporate indicators and metrics as well. Plenty of work going through national observatories to start monitoring and generating that national capacity. The Office of National Statistics, with a Wellcome-funded project called SOSCI, has been developing standard metrics for impact of climate change on health. Obviously, with the Lancet Countdown, we have a whole set of indicators, and I'm going to tell you at the end a bit about what we're doing in terms of refining those indicators to make them useful to these processes. And finally, we also have the Lancet Sustainable Healthcare Commission that is working on developing indicators for health system sustainability. So many reasons to have indicators, but it's important to note that there's different types of indicators that serve different purposes. Indicators can be really useful to monitor, evaluate a situation, identify risks. They can be very useful to inform policymaking, to help prioritize. Resource allocation being a key component of that. How do we prioritize where we put our financial, human resources? They're very useful to benchmark and to set targets, to hold ourselves accountable. They're very useful also for evaluation. That's a different set of indicators, but that we do need to develop to be able to evaluate the interventions as we deliver them. Obviously, accountability mechanisms become crucial. And there's also a whole set of indicators that are better suited for mobilizing political will and to generate awareness. So in all these different sets of indicators, different processes will have different purposes. And the different processes will also have different underpinning frameworks. You are not expected to be able to read this, but it's just a snapshot for you to see kind of what different frameworks for all these processes look like. Sometimes we have really good reason to have different frameworks because we're trying to do very different things. Sometimes there's not such a good reason. It's just that we worked in parallel. So the ATACH is trying to bring people together so that we don't duplicate efforts and we create common understandings to have a common baseline through which we're working in the development of indicators for different purposes. Now, as you will have heard throughout the past 2 days, in the context of the Paris Agreement set a global goal on adaptation for increasing adaptive capacity, increasing resilience, and reducing vulnerabilities to climate change. Different to what happens in mitigation, that we have a number that is our climate goal, our climate target, it's very difficult to set a target for adaptation. So it took much longer to the parties of the Paris Agreement to define what that global goal looks like. But very encouragingly, we do have clear definitions now for the global goals, and there's a specific goal for health that is what you can see on screen. We have different targets within the global goal on adaptation, and the health target is target 9C, as you will hear it being called sometimes, is about attaining resilience against climate change-related health impacts, promoting climate-resilient health services, and significantly reducing climate-related morbidity and mortality, particularly in the most vulnerable communities. This is what we call the health target of the Paris Agreement, but there's many other targets that are also very health relevant, including a target for clean water and sanitation, a target for food security and food systems. We have targets for infrastructure, targets for human culture and human development, and all of those come into delivering a global goal for adaptation to be able to cope with the unavoidable impacts of climate change. There's also another set of targets. So this is what we call the thematic targets. They're by themes. So we have the health themes in these thematic targets, but there's also a whole other set of targets that are what we call the dimensional targets, that are more process-based targets, and they look at the extent to which countries are delivering impact, vulnerability, and risk assessments, so important to underpin the second part of this, that is the planning for adaptation. They also have indicators to evaluate the extent to which those plans are being implemented. And finally, the extent to which we're undertaking monitoring, evaluation, and learning. All of this obviously cuts across every thematic target, but we also have very important aspects of health within each of these indicators. Now, what the parties to the UNFCCC did that was really unusual and really encouraging is that in COP28, they decided to invite independent experts. For the first time that the UNFCCC has ever done this, they invited independent experts to define what a scientifically sound, rigorous set of indicators would look like to help monitor these goals. So different parties to the UNFCCC reached out and proposed different experts, and that is how we came to being a group of 7 experts that were chosen by the UNFCCC to help identify these targets. Now, we're 7 experts, but we're meant to represent the broader community and the best available science. So the focus of the ATACH task team, because of the urgency of delivering the indicators for the global goal on adaptation, has been quite dominated by this process. It's a crucial process, it's time-bound. We have to deliver the indicators by the end of the year, by COP30. And we really need to have the input from the health community on what we think sensible indicators look like. Now, there's a catch here. We can only put forward 100 total indicators, and that is across everything. That means that for health, at most, and if we're really lucky, we'll get about 8 or 9 indicators. So I'm going to share with you what we've done so far. We've been getting different bits and pieces of guidance as we've evolved, and there has been quite a lot of interaction with the parties to refine the work. And we're at the last part of what that work will look like. So we've already put forward a refined list of indicators before the bond intersessionals. We received feedback from the parties, and now we're working on refining those indicators. For your awareness, we started from a list of 5,000 indicators, and we boiled it down to about 400, which is still too many, but it's not as many as 5,000. So the way that we've done this is in order to understand how we will prioritize, what we will want to monitor. We use the framework that you see on screen, yet another framework, but it builds on the WHO's framework, so you will see there some recognizable features. It's adapted to this process in particular. So we have the dimensional targets with the 4 dimensions that you see there on screen. And then we have all the other sets of indicators that fall under the health target that monitor mostly the impacts of climate change and how they're changing. So we're trying to monitor the change in the morbidity and mortality and the extent to which adaptation is helping reduce those. You're not expected to read this either, by the way. All of these indicators are online, so you can all see it online. We have published everything. But just to give you a very quick overview of what this looks like, for the process-based targets, so the dimensional targets, we've put our best efforts in ensuring that we're aligning really closely with the indicators that are already being collected and delivered by the WHO. Because one core component of this is that we cannot overwhelm countries with demands for monitoring and reporting. Now, the health target is a bit different because we don't have standardized systems for reporting on the health impacts in morbidity and mortality from climate change. So there is where we had to go and dig up what evidence can countries feasibly collect, what type of data might they have, and what other indicators are out there that we can draw from to reduce the reporting burden of countries, but tailor them to the global goal on adaptation. Now, I'm going to pass through these very quickly. They're all online, but one thing that I did want to tell you is we started from a principle very similar to the Sendai framework, in which we would have a headline indicator, and then several sub-indicators that would complement the information from the headline indicator and would be optional. Those sub-indicators are meant to add extra value, and we were hoping they wouldn't count towards the 100. Countries were very quickly to turn around and said, no, they do count, and you can only have 10. So now we're with this huge challenge in that we had selected 15 headline indicators, but we had in total a list of about 40 indicators. So we have to refine it and cull much of what we put forward. What you see there in the left is an example of what a list of headline indicator with complementary indicators look like, mainly drawn from the Sendai framework with adaptation of the Sendai framework to focus on climate impacts. That means that that will have to become one indicator. But there's a different type of problem, for example, when we look at infectious diseases, and I think that is a very clear example. When we talk about the health impacts of climate change and what needs to happen in terms of adaptation, we cannot have a one-size-fits-all. Different countries face different challenges, and the response has to be very tailored to the risk that they face. So it makes no sense to ask a country that is not experiencing nor is expected to experience dengue to have a dengue indicator, because it's uninformative for them. So when we try to monitor, for example, morbidity and mortality associated to climate change infectious diseases, we need to offer a list of indicators that countries can choose from with different diseases for them to select what's relevant to them, what really helps monitor adaptation progress. So we will have a set of options, and the challenge is it has to be just one indicator. So the ultimate metric has to be compatible across the different infectious diseases. If anyone here worked in infectious diseases, that is really complex because they all monitor differently. So the challenge that we're facing now is seeing how we can aggregate those indicators to have a standardized metric, because the very important point of the GGA is that it's not country by country, it's a global goal. So all countries need to report and produce one global figure. So that is the challenge that we have now. We have there the whole list of indicators. So we had put forward 15 indicators, about 40 sub-indicators, and we're trying to cut back following the guidance that we received from the parties. So we have to reduce the number to about 10, if we're really lucky, probably less than 10 for the health target. We have to ensure also that we're aligning across targets. For example, when we talk about water security, the water group is doing huge efforts in terms of capturing healthy water as well. So there's a lot of opportunity to ensure that other targets that are relevant for health are also representing targets that are sensitive to health outcomes. We need to ensure relevance of adaptation. I know this sounds obvious, but one of the main challenges that we have, and we were having quite an interesting discussion with the Netherlands yesterday about this, is that most indicators of impact are not sensitive to adaptation because of how the epidemiological model works, because generally we use a static relative risk function. And that means that if we're changing the relative risk through adaptation, and that is static, we're just not capturing it. So many of the indicators out there are not very useful to this purpose, and we have to develop new indicators that are time varying in terms of how they capture vulnerabilities. They also have to be globally applicable, but be available to capture the various contexts to adaptation, as I just said, for the example of infectious diseases. And the last bit that we're still missing, and that we're working on doing now, is that we need to capture means of implementation. That in the context of the Paris Agreement is a negotiated term, and it means what is the support that are being given particularly from the wealthiest countries to the most vulnerable countries with least resources in terms of financial, technical, and human capacities to be able to implement the adaptation efforts. We had a really useful discussion with the ATACH task team about a couple of weeks ago, I think it was, where we presented this work, and the members of the ATACH task team on indicators help us prioritize and establish what were their preferences for which indicators would be most useful to their purposes and which they would be okay being doing away with. That has helped us refine quite a lot, and now we think that we're closer to that 10 indicators, but we still have big challenges, including the challenge that I shared on how we're gonna pull together the indicators on infectious diseases. How we're gonna capture mental health is another big challenge, and how are we gonna ensure that the indicators are really sensitive to evaluate adaptation rather than just capturing impacts, which then falls into loss and damage. And that is a completely different set of negotiations. So that is the work that we're doing now, and we are very keen in getting people's views. There's all this documentation online, and also ways of emailing us. Our emails are there, so if you have suggestions, please do get in touch. I'm gonna share a very short bit on gaps and challenges that we found with the indicators. One of the main problems is that countries generally don't collect systematically health impact data, and if they do, they rarely report it systematically. It's a huge burden for data collection. And very rarely do we have morbidity. Generally, we get mortality data much more easily, which is much less sensitive. We also have challenges in terms of climate change attribution. We can capture impacts, but knowing what portion of that impact is due to anthropogenic climate change and what isn't is quite challenging. And it's a very important point for the climate change negotiations to know what that portion looks like. A crucial thing that we've been discussing here yesterday in length is disaggregation. We need to disaggregate by relevant vulnerable groups, and unfortunately most of the data that we have is not even disaggregated by age. It's not disaggregated by gender, indigeneity, or ethnicity. So most of our indicators are blind to inequities. Very few indicators, as I said, are sensitive to adaptation, so we have to work in turning those impact indicators to adaptation indicators. The diversity of impacts I already shared, how do we aggregate, and then the lack of standardized definitions is still a problem, because even when countries do report it, they all mean different things when they talk about heat-related mortality, for example. So pulling that information together is very challenging. Very quickly, I'm going to share what we are doing from the Lancet Countdown's point of view in terms of helping tackle some of these challenges, because it's something that I got asked
Time
about
is
a
up.
lot. I'm just wrapping up, thank you. As you know, the Lancet Countdown publishes the indicator reports that you see on screen. And we are bringing together about 100 different collaborating institutions globally, and we work in really close partnership with the WHO in this work. We share our data. We have about 60 indicators that mostly operate at a country level, and we share them through data level products and in a data platform. But what I wanted to turn your attention to is the work that we're doing in terms of refining our indicators and ensuring that we can make them most useful to this purpose. So that has two components where you're all invited to contribute, and we would want your contributions. The first one is that we're doing a stakeholder consultation to understand how our indicators need to be prioritized and how they can be made more useful to the purposes of those that are best equipped to use them. And the second aspect is we're doing an open call for indicator proposals. So if someone has a brilliant indicator that they think they can contribute to the Lancet Countdown, now there's an open portal for those contributions online as well. It's an open collaboration, so we do welcome contributions from any academic that can support the effort. And with that, I close, and thank you very much for your attention.
Thank you so much, Marina, for this very interesting presentation. So now I will invite Antonios Kolimenakis to talk about WHO monitoring processes and opportunities to advance monitoring.
Thank you so much, Kiladio. Bon dia, and thank you so much for the opportunity to present the work that WHO is doing in this field. Before I start, I would like to extend our thanks to the Ministry of Health of Brazil for having launched the Belém Health Action Plan, because this gives us the opportunity to align and to ensure that we have a comprehensive framework on the way forward, of course, towards COP30, but also beyond, and also to support the so-called action agenda. And I would also like to acknowledge several colleagues that have contributed to the few slides and the work presented that you will see in the screen. I would like to start by highlighting that climate change has been one of the most important strategic priorities for WHO in the general program of work, the so-called GPW14. And for this reason, there are some specific outcome and output indicators that actually respond to the two main components, the one on building climate resilient health systems and the other one on building low carbon and sustainable health systems, which of course, as you can also understand, align with some of the global commitments that countries are asked to respond and to actually monitor the work that they are implementing. I would also like to highlight the recently launched WHO Global Action Plan on Climate Change and Health. And this action plan indicates to us that this work responds to three important fields. The first one is on enhancing the leadership, coordination, and advocacy. Of course, per se, the evidence and monitoring, but also support the country-level action and capacity building. So the key ask beyond the work that WHO is developing in this field is how to ensure that there is a comprehensive framework of support when it comes to the country demand, but also to ensure that those different complex perspectives and aspects are well captured. And a few words about the Global Action Plan, which is, of course, an action plan which will be monitored through specific indicators to be developed. And at this point, I want to highlight the importance of having to align with the work that Marina and Amy already presented, both within the ATACH, but also in the GGA, and of course the necessity to combine and align and synchronize those efforts with the upcoming Belém Health Action Plan. So the objective of the overall monitoring progress is to ensure that countries and member states continue to be supported in different perspectives like capacity building, infrastructure, but also we ensure a participative process on important stakeholders that can help develop those different monitoring tools and support the overall efforts. Of course, the work of the Secretariat is to ensure that we efficiently track the country progress and develop comprehensive frameworks for complementing with the global goals like the SDGs. Of course, this is the famous so-called operational framework for building climate resilient and health systems with the relevant components. And in this respect, WHO has developed 20 indicators for its component, which respond to specific actions and to specific demands by countries. So in this respect, an index has been created to ensure that the monitoring progress is well articulated and really responds to the different needs of the specific subcomponents. So you can see, for example, how the different components are monitored and measured, like, for example, on funding, on ensuring that there are comprehensive surveillance systems and mechanisms to monitor the emissions, but as well as an efficient and comprehensive framework for monitoring what is the progress on the national adaptation plans and the health component. In this respect, there have been developed 10 indicators to measure both the progress on resilience and mitigation. So you can see the two aspects on building climate resilient, the climate resilient component as well as the mitigation component, and the different metrics for measuring what has been the progress in those different fields. As I said previously, this is an exercise. What you can see on your screen is an exercise which has been undertaken by WHO on mapping different sub-indicators related to vulnerability and adaptation assessment and HNAP. And I would like maybe to do a link to what Marina said previously with the first set of the GGA indicators. So we can understand that this is a very complex issue, that there are many indicators that unfortunately in the process of the GGA will have to be reduced, but on the other hand, we need to ensure that important aspects and important perspectives need to be incorporated and measured as we track the progress of countries, but vice versa, also when the country demand for specific support comes to WHO. Now, one of the important instruments to measure the progress is the so-called Global Survey on Climate Change and Health. And this year, we have recently launched the third iteration of this global survey. So the overall objective of that is to ensure that there is a tracking of country progress and on the progress of the health sector, on monitoring different types of commitments and different types of activities. So this survey is rolled out with the support of the regional offices, and I also take the opportunity to thank the support of the WHO mechanism, and specifically the country offices and the regional offices for ensuring a smooth collaboration in this respect. So the survey actually has been rolled out earlier this year, and we will present some very draft statistics that we have managed to gather so far. What I would also like to highlight again is that the outcomes of the survey will help to monitor and report on the progress of the GBW14, but also very importantly, we need to create an aligning framework because as we can understand in few months when hopefully the UA Belém indicators will be decided at COP30, then countries will be asked to report on the progress. And therefore, we need to ensure that all those different monitoring and metrics need to align, and we need to also ensure that there is a comprehensive approach when we ask countries on what the progress has been in respect, of course, to the adaptation, but also it is very important to ensure that there is a clear and informative framework for ensuring that we measure adequately the mitigation component as well. So as I mentioned, the survey has been rolled out through the mechanism of WHO, and it measures different perspectives in regard to governance and multi-sectoral collaboration, to risk surveillance and early warning, climate resilient and sustainable health systems, but also financing. And we will have the chance to also hear the aspect of financing, which is another really important aspect, because actually it ensures that we have the appropriate means of implementation for countries to measure the progress, but also to advance on the prerequisites in regard to climate and health. As I said, we have so far gathered 123 responses out of the full number of the member states, and I just take the kind opportunity to remind you to reach out to us if you haven't yet completed the survey. Our team will be very happy to assist you in this process. And of course, in respect, these will also contribute, your answers will contribute to having an informative approach and an informative metric on what are the needs and what are the challenges on this respect. Now, when it comes to opportunities for further engagement, first of all, there is this important opportunity to align with the Global Action Plan and develop a monitoring framework that will be operated in the global program and the programming of countries in the different regions. And also it is, as I said, we have the opportunity to align with the UA Belém work program, and the different objectives and priorities have been presented. So in this respect, I think we need to ensure there is a complementarity in this approach, and also there is, I would say, an informative approach that countries can utilize when they will be asked to report on what has been the progress on the adaptation component. Of course, all this work supports the COP30, but the overall UNFCCC processes as well. We can take the example of the NAPs, and we are well aware that in the next stages, the monitoring of the NAPs will be based possibly on the different GCA indicators. And we know that health, of course, is one of these. And this gives us the opportunity to ensure that when we will be monitoring in the close future, that all those frameworks will be connected and all the information can reach out, of course, when we come to aspects like financing, to see what are the exact needs that countries have and that countries request to be supported to. Of course, this will support some more technical aspects like the work on the index that has been presented earlier on, and on developing those resilient and low carbon sustainable health system approach. But also those answers and this framework will support us to formulate what will be the next stage and the next apparatus of the global survey. And of course, this gives us the opportunity to ensure that all the pieces are well connected and that we really respond to the country needs. I think I'll stop it here. Obrigado pela oportunidade.
Thank you so much. Thank you very much, Antonis. Now let's move to Kanza Ahmed, who will speak on initiative to develop a statistical framework and unified methods for official reporting of climate impacts on health. Thank you.
Good morning and bon dia. Thank you very much for the opportunity to come and briefly speak to you today. And before I start, I just want to take this opportunity to thank our Brazilian governmental colleagues for their leadership in organising this event, and especially for the wonderful Brazilian hospitality that I think we've all been enjoying whilst we've been here. So I want to build upon Marina's previous presentation about the country-level observatories, and particularly talk about the Office for National Statistics standards on, for official statistics and climate and health interactions, or SOSTI, and why we feel that this is quite important. And also actually just to basically build upon some of the conversations that have been had in the previous discussions. So we have been talking about, having targets and indicators, but why do we think they're important? Well, as Marina was talking about, there are challenges that we have in terms of, the shortage of tools, the harmonization, and the lack of resources. Right now, we're all sat here full of enthusiasm, right? We've got all these ideas we are going to go back to our countries with. But actually, when we get back and we land and we get back to our offices, the reality of implementation is going to hit us. How are we going to do this? And how are we going to measure when we've done it? And how are we going to know we've got it right? And part of that problem is that actually we don't have harmonized tools. So how one country measures progress is very different to how another country is measuring it. And that lack of harmonization really impacts our ability to tell that story about our progress when it comes to climate and health. So the SOSTI project was developed with this in mind. The idea was to actually begin to develop a series of indicators that are useful and going to be usable, and that are actually practical and based on the needs that we have within our countries, but also generalizable enough that, as we talked about, it's got to be global, it's got to apply to everybody and not just be specific for a few countries, but also actually to use tools that everybody has access to. Because quite often when we're developing targets and indicators, the challenge is trying to collect all that information and analyze it and not having the tools to be able to do so. So the aim of this project was to define what statistical framework should look like, what should the indicators be, and what should the methodologies be. And actually to develop a portal or a platform in which actually we can share our learning and actually upload our own results and our own learning, so we can actually work collaboratively together rather than trying to develop indicators and methodologies in our own little areas. So the conceptual framework of the SOSTI project is actually adapted from WHO. The key thing about this project is we have not tried to develop something in isolation. This has been about working with other countries and with global collaborators and understanding what is already out there. What we don't want to do is replicate what already exists, but we also don't want to do is add to the burden, because we're already under a lot of pressure, particularly with the existing frameworks that are out there. We recognize that actually saying here's another 20 set of indicators and targets and methodologies isn't helpful. What people want to know is, how can I measure the SDG goals? How can I measure the Sendai goals? And also have that story and that narrative around what the impact is of climate change on health. So, as I said, we haven't done this in isolation. We've done this with global engagement and support. And the key partners for, in this project, alongside the Office of National Statistics, has been the UK Health Security Agency, the University of Ghana, and AIMS Rwanda. And all of this has been funded quite gratefully from the Wellcome Trust in order to take this forward. And what we have done is, through those partners, is tap into all the other networks that are out there, and actually begin to have the expert group bringing in those ideas and making sure that we're not replicating what already exists, but also actually not creating a burden for our partners, because we recognize that actually it's a burden enough and it's challenging enough to try and implement any changes or adaptation, but then to be able to count and measure the difference and tell the story is a whole challenge in itself. So, what is the benefit of this project? What is the key message that I'm coming to you with? Well, actually, what this project is doing is it is a start of having operationalization of high-level indicators by translating them into more specific and feasible subtopics. So what it's going to do, the outcomes of this project is that we actually apply state-of-the-art statistical methods so we can attribute the health outcomes of climate change and climate hazards, right? What's really hard is for us to understand what climate hazards had that direct impact on health, because there's a lot of confounders in the process. There's a lot of other things that interact that actually could be the cause of the mortality, could be the cause of morbidity. And then we have cascading hazards as well, which add to the complexity. So actually trying to simplify that process so that it can tell that narrative so that actually we have information that can inform change is really important. And what the project will also do is actually provide methodological guidance and code and online tools for implementation. This will be accessible for all. And that's been a really important part of this project, is that if we are talking about global goals, part of that is global accessibility and the global ability to be able to interact and to develop the methodologies and to be able to use the methodologies. So this is a call to action. We want you to get involved. We want to hear from you. We recognize that we cannot do this in isolation. There are 3 countries, UK, Ghana, and Rwanda involved, but we alone cannot develop these methodologies. We need your input, so please do get in touch with us. We do want to hear from you. And actually, you know, one of the things that we want to kind of make clear is that we can't manage what we can't, you know, measure. So it's really important that we're able to develop a measurement process that works for all of us. Finally, I do want to take this opportunity to thank all the partners that have been involved in the project, and they're listed on the slide behind me. This truly has been a challenging project. We understood quite early on why nobody has ever attempted to do this before, because it isn't easy to do attribution. And everybody has sort of a lot of different challenges coming in. But people have been committed to this, and we are determined to develop something that is useful and usable, and hopefully in time will be used by all of us here so that we can finally develop that story and narrative for the public, for the population, for professionals, and for policymakers to explain what is happening, and with the billions that are being invested into adaptation, to know what difference it is making. So I'm going to leave it there, but I want to thank you very much for your attention. Please do come and approach. I'm around today. Come and have a chat with me. Do get in touch with the team. We would love to hear from you. And obrigada, thank you very much.
Thank you so much, Kanza. So we got a very interesting first round of contribution. These have been very brilliant presentations. But now we'll move to the round table. So thank you again for your insights. Thank you very much.
Please, before leaving the stage, put yourself in front to have a picture. Agradecemos a rica contribuição dos nossos.
Thank you very much for your enriching contributions. And for the second stage, would like to invite Tatiana Machufo, Coordinator of Health and Environment of the National Institute of Public Health of Mozambique. Doma Huang, Deputy Head of the Division of Environmental and Occupational Health, Ministry of Health of Vietnam. Mauricio Barreto, Public Health Expert of CIDAX, Fiocruz, Bahia. Brian Riley, Indicator for Monitoring and Evaluation of Investment Specialist. Youssef Nassef, Director of Adaptation Division of UNFCCC. And once again, to conduce this work, I'll pass the floor to Galadio Youssef.
Thank you so much. So we'll turn now to a roundtable focusing on measuring progress in the development of health indicators and alignment with the implementation of the Belém Health Action Plan. We listen first to Tatiana Marufo, Coordinator of Health and Environment from the Institute of Public Health in Mozambique, and we want to hear your country perspective surveillance system. So we'll have 2 rounds of questions. Let me ask the first question to Tatiana. Tatiana, can you please share with us Mozambique's experience on advancing the work on indicators, on enhancing integrated surveillance and early warning systems, and how can the development of GGA indicators support this process, and what are some of the barriers that countries like yours could face?
Thank you very much. First of all, I would like to thank WHO and ATACH for inviting me for such a prestigious panel. And allow me, please, to talk in Portuguese, since it's the language that I'm more comfortable with, since Mozambique is a Portuguese native speaker also.
I'd like to share that Mozambique, through the Ministry of Health, created a platform that is called the National Observatory of Health. And I continue to advocate for our National Observatory in all the events that I participate. This observatory is a structure, an appropriate structure to do the monitoring of indicators and the integration of data or risks of climate risks for health. We work within this platform in the integration of data, and this data comes from many sources. And these are not only health data, but we have data from other sectors, like metal, fabricking, social development, mathematical, financial statistics, and so on and so forth. So this data is aggregated in a platform, within a platform. And in this platform, we work with our functions, and we need to understand first and foremost the situation of the country, the trends, the measuring of indicators, and we have the capacity of predicting the future scenarios.
So in the last years, thanks to this platform of the Observatorium, we have been contributing in order to deliver to the Ministry of Health risk maps for climate-sensitive diseases. In the last 7 years, we delivered these risk maps for the surveillance teams and response to emergency teams so that they can anticipate their plannings, but also respond appropriately to emergencies that we face, especially during the rainy season and the drought season. And with these scenarios and the risk maps that we are making available, we managed to anticipate risk 10 weeks earlier, and from 10 weeks to up to 6 months if we're speaking of a national level map. And so we believe that thanks to this observatory and this platform we created, it happens to be a very positive platform. It's a very interesting platform that aggregates data, but also will allow us to decline the data for a subnational and local level so that we can better surveil the indicators that we wish to surveil. Thank you very much.
Thank you very much. Domancon, I hope that I pronounced the name very well, from the Minister of Health, Vietnam. So can you please share with us Vietnam's experience in developing also health indicators that could support the conduct of vulnerability and adaptation assessment? And what are some of the opportunities and challenges around the process you put in place?
Okay, thank you, Dr. Guladio, to invite me to share our experience in developing the VNA assessment tool and health indicator. So at this moment, we would like to share how we can develop the VNA assessment tool and health indicator. So in Vietnam, firstly, we started to develop the VNA assessment tool and health indicator firstly in 2018, and we updated in 2024 with IDB and WHO support. So the VNA tool including 42 indicators grouped in 3 categories: climate hazards, health sensitivity, and also adaptive capacity of the health system. So what is the most important thing we think about the indicators is that the indicator should be feasible to collect its data, and it should be very easy to collect. So in order to ensure the feasibility of data collection, we also, firstly, we started by listing all relevant indicators as much as possible. And then we shorten the list of indicators by assessing the feasibility of data collection. And then, for example, for each indicator, we assess how we can collect the data, how the availability of data and for the data collection. And if we see that the data is available or the data source is clear, so we keep the indicator. If not, we drop it. So we have a list of indicator data, and then next we tested the list of indicator by working with some relevant ministry and other stakeholders to discuss about the indicator and how we can collect the data, and then we finalize the indicator. So after that, we also organize some training course for local health staff in order to support the massive implementation later. And then by this opportunity, we also have a chance, opportunity to gather the feedback to improve our VNA indicator and also health indicator of the VNA assessment tool. Talk about the opportunity. Yes, I think the first opportunity is the government requirement. We have full legal requirement from the government to develop the EDNAP. So if you want to develop the EDNAP, you need to have evidence and input. And if you want to have evidence and input for the EDNAP development, you have to conduct the VNA assessment tool. So that's why I think this is a very good opportunity for us. And the second one is, I think the support, the financial and technical support from WHO and ADBs together with the government, but it is very useful for us. And the next one, luckily, we have a strong team to develop the ATACH and have indicator. We have a strong team, including the national experts from Hanoi School of Public Health, from National Institute of Hygiene and Epidemiology, with the contribution from international experts. For example, we have support from Professor Christy Abbey from University of Washington. So she gave us a lot of useful advice and input for finalize the indicator. And I think talk about the challenge. We have many challenges, but the key challenge is the indicator is very complicated. And we have so many indicators in the VNA assessment. So sometimes the indicator is not clear. It's not clear, so how we can understand clearly the definition of each indicator so that we can collect the data correctly. And the last one, the data of the indicator should be collected from different ministry and different sector. But which collaboration among ministry and sector is very weak. The collaboration is very weak, so maybe this is content for our data collection process. Thank you.
Thank you very much. Let me turn now to Mauricio Barreto from CIDAX, if I pronounce it very well. Please share with us how the work on indicators can advance themes such as equity that are central to the Belém Health Action Plan.
Yeah, I'm only going to speak in Portuguese, and as I received in advance this question, I prepared a small text that I tried to read to go in my 3 minutes. O indicador é nada mais.
The indicator is a metric developed for something that we need to codify. And like any metric, other than internal characteristics, it has meaning only if it's scientifically solid and that it's a results in social consensus. The metrics give us an idea of the dimension of an object, a group, measured in absolute terms. However, if it's duly calibrated and standardized, it offers information, relational information on the same context and group in comparison with the other, enabling us to demonstrate that this object, context, and group is similar or different from the others. Equity in health refers itself to inequality due to some type of injustice. So to understand inequity, we need to measure inequality, which is a complex dimension, socially constructed, and according to different political views. When we're speaking about healthcare, things have been changing in different social and political contexts. For example, the difference between men and women used to be seen as different of sexes and used to be seen as merely biological. With the struggle of women, the understanding changed, and therefore today they're seen as inequality of gender. When we're speaking about whites, black, indigenous populations, they used to be seen as biological inferiority. Nowadays, it's very clear that these different expressions of racism, which were constructed throughout history and were fed by exploitation of dominant groups. And so the action plan of Belém, equity is defined as a fundamental and transversal element in order to propose adaptation measures that approach simultaneously ethnical, social, gender issues which are exacerbated by climate change. However, it's important to mention that despite the fact that it's a transversal issue, strangely, it was not object of discussion during this conference. In order to manage to comply to the plan, and in order to go in depth, we have to build a very long path in order to build a path of consensus which involves all the interested parties. Here we had some presentations and debates which were crucial and involved social participation. However, equity and inequality are relational, and the only way to quantify existing inequalities due to implementation measures which are seen on populations are only possible if we can measure whether vulnerable population had their health improved. And if we take a look seriously at issues of equity, mentioning these issues in our discussions in the months before COP, we also need to construct consensus. And we also need to define robust elements. And this is imperative for us to make sure the Belém Action Plan are aligned with its principles. Thank you.
Now we are going to listen to Brian Relay from the Asian Development Bank. It would be interesting to hear from the perspective of an multilateral development bank how the development and operationalization of health indicators can support the monitoring and evaluation of investments on the field of climate and health.
Thank you very much, Mr. Moderator. First, may I congratulate Ministry of Health Brazil and my colleagues at WHO ATACH and partners and panellists here on the Belém Action Plan. We think it's a fantastic endeavour, and certainly from the ADB's perspective, we look forward to supporting fully coming up to COP and beyond. I'm Brian Riley. I'm the health specialist at the ADB, focusing on climate health and the Climate and Health Initiative in particular. Those are friends of us who are at Dubai, COP28, December 23, might have been present where the Asian Development Bank, along with WHO, Dr. Tedros, and 10 health ministers launched what at ADB we called the Climate and Health Initiative, which was really born from the engagement with the G20 and COP presidencies. So that initiative I lead, and that has been scaling up its financing over the past 18 months, nearly 2 years, since COP28. What I might talk about there is a little bit about the bank's financing. Prior to the pandemic, health was not a big agenda at the Asian Development Bank. It was about 1% of the financial envelope. The financial envelope of the ADB is around 30 to 35 billion US dollars per annum. And prior to the pandemic, health was 1%. During the pandemic in 2021, 22, 23, it scaled up to about 30 to 35% of the entire bank's portfolio. The ambition for the health sector at the ADB, which is growing, is to have between 6 to 10% of the entire bank's investment portfolio for the health sector. So that translates to about $2.5 to $3 billion US per annum. We also launched at the ADB our major regional health event earlier in July, which was in fact the biggest event that ADB has ever had, including across sectors energy, transport, agriculture, water, that have traditionally been the large main game at the bank. So thanks for that. Now, knowing that the bank's portfolio is stabilising to that financial envelope, we're trying to structure our investments along the 5 G20 principles: resilient health systems and services, low carbon infrastructure and health systems, decarbonising the health supply chain, and we're working with a number of partners to do that. Novel financing, of course, and increasing the amount of novel financing, and then working very closely on the One Health agenda, the human-animal environment interface. So that's sort of how we're sort of trying to structure our investment pipeline and portfolio. The other thing I'll say is, for the bank's value proposition, we work with treasuries and ministries of finance, so we can work quite nimbly across sectors and bring, some co-benefit discussions on health across these sectors. And I look forward to the indicators and working with the Belém team to try and implement those indicators in our co-benefits and other sectors' work at the bank. Thank you, Mr. Moderator. Back to you.
Very interesting. Thank you so much, Brian. Now let's listen to Youssef Nassef from UNFCCC. Would like you to share UNFCCC's role on supporting the incorporation of health indicators in Paris Agreement processes.
Thank you, and my appreciation to everyone here. I learned a lot from the previous speakers, and this will, I think, enrich what I'm going to say now. So, as the currently active treaty, the Paris Agreement, which we have now, it's a very interesting construct. It's a pledge and review process, meaning countries pledge to do things, and then every 5 years we have this report card. The world assesses how well it's been doing on mitigation, on adaptation, on means of implementation, and that's called the global stocktake. So 2 things the global stocktake needs in order to be able to make that assessment. One of them is a very clear, concrete quantitative, qualitative, abstract, if you like, set of indicators that show where the world is in the aggregate. And it's not about individual countries, but the globe as a whole. I think Marina made that point earlier, that this is about a global prognosis. And the second thing that this stocktake needs, it's not enough to know where the world is, but also to know where the optimal state the world is aspiring to is in terms of these indicators. So it's important to know where we are. Say we have these 100 indicators saying you have 5 out of 10 in this, you have 100% here, you have yes or no there. But also this has to be compared to where we need to be. It's not enough to have the first without the second. So that's the first point in terms of where this fits in the international system. And the idea there is once the world assesses the gap, then somehow it will spring into ambition to fill that gap. Whether that will happen or not remains to be seen. So the first global stocktake took place in 2023. The second one will be in 2028. Consider the first one to be a pilot. Things weren't really as rigorously prepared as they will be now, especially on adaptation when we have these indicators. That's one part of the picture of why the UNFCCC needs the ability to quantify or qualify where it is in the aggregate as a planet, to be able to know how it should proceed and to what extent the gap is. Second, in order to make use of these indicators, not enough just to agree on them and that's it, but these have to be internalized in the country's systems in ways that allow them to share this with the international community and this assessment process. So this could come through the national adaptation plans, we heard about that, the nationally determined contributions, the national communications, the adaptation communications, biennial transparency reports. So there are tools and planning systems in place at national level that are supported by the UNFCCC in order for the countries then to be able to assimilate these indicators, and they're quite context specific. So there's comparability, but there's context specificness, and I'll explain that later, in order to be able to feed into the global stocktake process. Now the third element of this, which is a nice side effect, is how the international community, non-UNFCCC entities have been affected by this new structure that has come out. So we know the MDBs have already taken on board the targets from the GGA as an organizing principle, and we heard this this morning about how many different organizations have also been influenced by the targets and will incorporate the indicators to the extent possible. So I think this is another way that the process has created a simple set of givens, a normative process to be able to assess, and it becoming a standard across the board. I'm hearing of so many different think tanks as well taking this on board. But the core thing is the need for the world to know where it is every 5 years and compare this to where it needs to be, and then instituting action to fill that gap at a global level. So I'll stop here till we get to the second question.
Thank you very much. Thank you very much. Now, I think we have a few more minutes to give a chance for a second round of questions. So, Tatiana, I'm coming back to you for a last question. So, how do you envision multi-sectoral collaboration in the process of measuring indicators at the local level? And how can this contribute to the measurements of subnational indicators?
So, obrigada. Eu quero.
Well, I'd like to pass on the experience of the observatory once again. We have the report now, the report of the impact of the climate changes, and we bring about some results and some outcomes of the studies that we made from 10 years ago, from a first study of 10 years ago, and we have the impact on the level of health and on the level of public and social development as well. We have a cross-cutting group, working group now with people from the sector of energy, electrics, transport, health, finance, and so on and so forth. They work with us in order for them to share their experiences and their experts and their expertise, and we jointly interpret their studies as well as our studies. So we brought about a platform that allows us to share experience, to communicate with other sectors as well, and also we can, through this platform, do the activities, the cross-cutting and transversal, right, execution of our activities. There are limitations, mainly when it comes to data. The format of the data is different. The quality of the data coming from each sector is different. However, even with these challenges, we can bring about and recognize the bottlenecks and the gaps that we have as a country, and therefore we can incorporate new indicators and also come up with new activities. So we have this platform now, and we created this cross-cutting group. And with the knowledge that we have, we are able to improve our activities. We have multiple formats of data, as I mentioned before. However, we are harmonizing them. And we brought about this perspective that the collaboration among the sectors is of paramount importance for our activities. And this will allow us to have multi-sectorial activities, and we will identify the lacks that we have in multiple levels. So we will be coming up with a new report within the next 4 months, and that's it. Thank you.
So now, back to Doman Kong. Do you see the necessity to revise or update the VNA indicators? If so, when would be the appropriate time to do it?
Thank you for the question. I think the key objective, two key objectives of VNA indicator is to provide the input for development of ETNAP. In 2018, we have to develop the ETNAP for ETNAP, and then in order to do that, we developed the VNA indicator for ETNAP development. And then after we have the VNA indicator and the input, so we developed the ETNAP 2019 to 2030 and vision to 2050. So according to our government regulation, every ETNAP should be updated after 5-year implementation. So that's why last year we already updated our VNA indicator, and the number of indicators from the first version is 54, and now we cut down number of indicators could be 42. And then we updated the VNA indicator in order to provide the input for updating the new ETNAP 2020 to 2025 to 2030. So on the other hand, I think in WHO, WHO have new guideline or new indicator for monitoring and measure the progress of climate change and health. Maybe we need to review and update our indicator again at country level in order to harmonize with global level. So I think it's very important if WHO can provide the guidance and platform for other country, like our country, how we can update our indicator, how we can harmonize the country indicator to the global and the regional indicator. Thank you.
Thank you very much. Thank you. Now, Mauricio, second round of questions to you. What are some key questions involved in building indicators that can be used to measure progress in achieving health equity? It's again about health equity as a result of climate mitigation and adaptation measures.
Eu queria colocar primeiro 3 pontos.
First and foremost, 3 points that are of paramount importance. Marina and Kansas showed us how hard it is to construct indicators. And equity indicators is even harder to construct because it is sensitive, right? We have controversies and so on and so forth, and therefore we need a consensus in order to develop these indicators. So this is the first point. We can have global indicators. However, we have multiple differences among the nations. But in general, the debates on equity are national debates. The nations will discuss this internally. Each country has its own history, its own constitution, its own social, social construction, let's put it this way. Another point is that a great part of these debate in terms of equity are territorial debates. I didn't propose these debates, and the plan shows us that we need to have a debate that is generalized or harmonized, and this is a challenge to be concreted. So this was put on the table by Marina, and each working group will need to identify the source of data as well. And this is a debate that is starting now in different contexts. In terms of the classification, we need information of the ethnicities of the population, and this data is in the data bank of the country, but not in the data bank of the Secretary of Health, for example. So we have to unify this data. We have to check the data that was developed, the studies that were developed before, in order for us to aggregate the information that we already have in each country. And if we do not have any data, in case that we do not have any data, we have to construct this data bank. And this should be added to this plan. Otherwise, we won't be able to reach our targets. So if we do not have a piece of information, we have to develop it. We have to collect the data. We have to collect through the mechanism of data collection that we already have, or if we do not have any, we have to construct this mechanism. And to wrap up here, we do have some experiences here in Brazil and worldwide of instruments of integration of data, which allow us, right, to explore in details the ethnicities, the information using the integration of multiple data banks that are already existing in each country. So in each country we do have a data bank. We can explore it and harmonize it in order for us to integrate this data. Thank you.
To you. Now, Brian, your second round of question. How might MDB's plan systematically measure, track, and report the health core benefits? You even mentioned it already in your first answer. Arising from climate investment across non-health sectors, such as energy, transport, water, agriculture, and urban development, in line with the cross-cutting ambitions of the Belém Health Action Plan, and the Evolving Indicator Framework under the UAE Belém Work Program. Question, but...
I'm going to try and do this in 2 minutes, although it may take 2 days, but I won't take that long. No, it's a great question, and in fact, something that we really look forward to working with our WHO ATACH colleagues on. And our assessment is the action framework will in fact give us a great platform for discussing across the sectors that we work with at the bank how to incorporate effective metrics into their investments for co-benefit purposes. So we look forward to doing that, and I might also give a special shout out to our friends at the World Bank, where we've been working on some of these methodological issues in terms of the health sector's access to climate financing, methodology, capacity building, investment cases, building the investment case. And on that front, I might mention, for us in the health sector at the bank, the calls on grant and technical assistance resources are escalating rapidly. And the reality is they're constrained. More often than not, the technical assistance we can bring to bear to assist developing costed proposals, building the upstream diagnostics for vulnerability and risk mapping, are tied to now an appetite to take out loans. And on that front, that we have a range of financing modalities on the loan front. For countries that achieve results, we can disperse based on those results. For countries that introduce health and climate policy reforms and systematic reforms, we can structure financing modalities around those also. And where there's an appetite for those, then we find it easier to mobilise technical assistance and grant resources. And that being said, so one example is the Climate and Health Initiative. So we've mobilised already 6 million with an ambition of 10 million. And I might shout out to our friends at the UK Foreign Office for that as well. They contribute to a trust fund managed by ADB. So, and of that, we look to build health sector capacity, working with WHO, on climate diagnostics, risk assessments, standardising country assessments for vulnerability. And so we look forward to helping cost those and bring in financial resources for those things. The other one is building capacity in the health sector. We, treasurers and finance ministers, say to the bank, our health sectors don't know how to access these climate funds. They're not great at designing health sector investments, and we know the transformative additionality principles there, but the health sector has limited capacity to do these diagnostics at country level, to access and unlock climate financing. So we can help with some of those upstream funding sources. Yeah. So I might leave it there. We welcome the Belém Action Framework. The metrics will help us design better co-benefit measurements across sectors. Thank you.
Thank you very much. Now back to Youssef. You already clarified what the global goal on adaptation means. We would like to ask you to give your view in the context of GST2. What attributes should indicators possess to effectively assess progress toward the global goal on adaptation?
Well, thank you. I have 5 points. One is that something that I said before, that indicators must be anchored to a future landing zone. We really don't care about measuring today versus the past. It doesn't tell us anything for the global stock take. We want to know where we are versus where we want to be. So typically expressed as a percentage where the optimal landing zone is 100% or 0%. And the corollary of that is that when you get an indicator that says number of laws or number of policies, these are false proxies. They tell us nothing in the absence of what's the optimal number that we would try to reach. So this is something that will be dispensed with in the final version. Second, they must account for contextual variation while maintaining general comparability across countries, because the state of being resilient or the state of being adapted is something that differs from country to country, differs by knowledge system, differs by cultural context, by administrative level, and even by medical systems in terms of epistemologies, ontologies, and methodologies. So there is a very context-specific component to it that has to be accounted for when we produce this cookie cutter approach of indicators that apply to everyone. So once localized, they have to be malleable enough to account for these different contexts. Third, they must account for trade-offs. We might be optimizing the state of resilience in one sector in ways that can affect others. So this curation has to be looked at as well. We need to make sure that we know the relationships between the different targets and how an increase in one variable in one can affect another variable in another. And that applies across targets, across sectors, sometimes across administrative levels, but also across countries, transboundary. Fourth, must account also for differentiated vulnerability across different segments of society and differentiated care associated with that. We know that there are different, age disaggregation, gender disaggregation, etc., all kinds of segmentation to be able to, again, know how that when we average things, we're not leaving certain components totally outside of the picture. And this is both relevant for anticipatory and reactive response. And finally, the most difficult one is they must be forward-looking in terms of accounting for future hazards and future changes in frequency and intensity. This is not a linear change. When you have a hurricane that happens one week and another one that happens the next week in the same place, it's a totally different response. It's not just twice of the same. And so assuming that the future is a proxy of the present plus some more climate change is just a false mindset. And trying to inject some foresight there, on the one hand, on how ecological decline will proceed, but on the other hand, how modern frontier technologies can also alter the way we are thinking of our responses. And then how to incorporate all this in the indicators is a tremendous piece of work, which has not happened yet. But, I mean, we have to start somewhere. So we will have a good product in Belém, but that is not the end of that road. It's just the starting point for a much more intense series of iterations thereafter. Thank you.
Thank you so much. I know that we are over the time when this session should be completed. We started with a certain delay. Let me say a few words towards closing this session. The first thing I might say is that in this session, we have learned a lot about the work done and in progress from different initiatives and countries, and how we are near to getting agreed indicators at COP30. Many thanks to all the experts contributing to this important work. Many thanks to ATACH and WHO for significantly contributing to these efforts. We understood that the indicators lists at the end, and the lists, every list, in fact, are not meant to be exhaustive, but to represent a range of conditions and successes that could be tracked globally. And Youssef has emphasized on that as a goal, global goal. Indicators are key in highlighting essential trends, and we all need these. They are the starting point in thinking and the reference in shaping the process of evaluation and monitoring of progress. They help to simplify a complex array of information. We have seen it, sometimes hundreds and thousands, turning data into relevant information for informing the public and decision makers, and to emulate required action for filling up gaps and reaching goals. Many thanks to the brilliant contributors to this session, from presenters to panelists, and many thanks to the audience, you, for being here this morning. And this very much inspiring session is over. Thank you so much.
We appreciate your contribution. Please, one quickly photo. Thank you very much. You can now take your seats at the audience, please. Dando continuidade à nossa programação, iniciamos a...
In order to continue our program, we'll begin session 5. Session 5 will be composed by a discussion panel with different specialists from different regions and fields. The theme is evidences for public policies guided towards the construction of resilience-based systems. And as a moderator, we invite Alan Dangour, Director of Climate and Health of Welcome. We'd also like to invite Marina Romanello, Executive Director of Lancet Countdown of Moderator of GT1. We also would like to invite Daniel Booz of the Pan American Organization of Health, PAHO, and moderator of GT2. Vincent Bertin from UNITAID and moderator of GT3. Nick Watts, professor of the National University of Singapore. Romulo Paes, representative of the Brazilian Association of Collective Health, Abrasco. Lucia Xavier, General Coordinator of the NGO Criolla. This session will also count with the participation of Agnes Soares da Silva, Director of the Department of Environmental Health and Surveillance and Worker Health, Ministry of Health, Brazil. So is everything under control?
Director Alan Dangour.
Okay, brilliant. Thank you all very much. Absolutely brilliant to be here. Really excited to be moderating this session. So we've got quite a lot to do. We're running a little bit late, but we're going to keep it nice and tight. The first thing I want to do, obviously, is thank the Brazilian government and the Brazilian Ministry of Health for putting this on, and our colleagues from WHO ATACH. It's been a fantastic meeting, so huge thanks. I'd like to apologize for not speaking Portuguese, but I would simultaneously like to thank our interpreters who have done an amazing job, and our sign language people who have done an amazing job. So could we... it's been fantastic, so thank you for that. Okay, then I wanted to ask you all a question. Put your hand up if you've ever been to a conference before. Put your hand up if you've ever been to more than 10 conferences before. All right? 50 conferences? Okay, anyone who's been to more than 100? Okay, have you ever been to a conference before where you've been specifically asked by the government of the country to help design an output that's actually going to be useful? Put your hand up. 1. So this does not happen often. And I think we really need to acknowledge how extraordinary it is that we've been asked by the Ministry of Health to help support the design of the Belém Action Plan, the Health Action Plan. I think this is a fantastic thing. It shows some real insights. It shows that this government really does want to follow through on its ambitions for Mundial, and I think that is it's something that we can all learn from. So thank you hugely to the government of Brazil. All right, that's enough from me. We're doing 3 things today. Number 1, we're going to hear back from the very brave moderators of the working groups, and they're going to summarize what we've learned over the last 2 days and hopefully give us some pointers for some solutions that we could talk about. Then we're going to introduce 2 of the supporting documents that were mentioned on the first day of this conference. One supporting document, one of them is on evidence for policy, and the other one is on governance with social participation. Then, thankfully, we have Dr. Agnes, who's going to summarize it all brilliantly for us. So that's what we've got planned for you in the next 60 or 75 minutes. And we're going to start then with the feedback on the working groups. You will remember that the first working group was on health surveillance and monitoring, and brilliantly we have Marina Romanello from the Lancet Countdown who's going to talk us through the main findings so far. Thank you very much.
Thank you so much, and thank you, Alan. I will echo your words and thank the Brazilian Ministry of Health for giving us this opportunity and also for providing a challenge of how we can actually make this action plan more ambitious, more action-oriented, and as Alan said, it's unusual that we all get to participate so closely with the process, so many thanks for that. I would also like to thank everyone who contributed to the working group. We had really good discussions there. I went round the tables yesterday and everyone was so engaged, was being so generous with the sharing of their knowledge and their experiences, so thank you so much for adding so much value to those discussions. I will try to summarize what were approximately 4 hours of very intense discussion in about 10 minutes, so I will not do justice to everyone, and I apologize if I missed some important points, but everything is recorded. So we were discussing the monitoring and surveillance aspect of this action plan. So it was very focused on how we can improve the monitoring and surveillance and how can we use it more effectively to protect people from climate change. And the first thing that obviously we discussed is the need to ensure that we have transfer of knowledge and technology. We heard from countries, including Nepal, Bangladesh, the Netherlands, Senegal, and Brazil, about the incredible work that they've done in setting up very robust, very sophisticated platforms for monitoring and for surveillance. And we saw that sometimes this happened in parallel with a lot of resources going to developing those technologies, and there's such a wealth of expertise that went into developing them that could be shared for other countries to leapfrog through the development of that as well and to optimize the use of resources. So the first thing, bringing that knowledge together and encouraging the exchange of knowledge and know-how. Obviously, intersectoral integration was key to the conversation. This is something that the WHO-WMO Joint Office has also been working on. But we discussed also the need to integrate across geographies to ensure that we're not exclusively top-down, which often happens, but also bottom-up, that we build on the enormous wealth of knowledge and capacity that lies within communities and using citizen science in respectful manners to adequately reflect the priorities and the knowledge from communities, and start looking at ways of integrating traditional knowledge and indigenous knowledge into our sometimes more Western and less flexible systems of monitoring and evaluation. We heard a fantastic case study from Pio Cruz on that. Now, aside from everything that we've discussed on how to improve, there were a few elements in which we challenged what was already there. So the first thing is, we talked a lot about surveillance and monitoring, and there's detail of that in the plan, but there's not much detail on what are we going to do with that surveillance and monitoring. Infamously, one of the co-chairs of the Lancet Countdown says we shouldn't be monitoring our own demise. And if we just monitor, the chance is that if we don't do something about it, it's not that useful. So we need more detail on how we're going to use the information of monitoring and surveillance. We need time-bound commitments of what we're going to do in terms of implementing cross-sectorial response systems, in terms of funding for the development of those responses and surveillance systems. And we also need very clear processes, acknowledging that each country will be different in how they will need to do that surveillance system and respond to it. But we need to have common principles that allow us to ensure that the response is sensible, sound, and adequate to the measure of the challenge that we're facing. Some of the things that we discussed, and I'm not going to go into a lot of detail on this, but some of the things that we discussed is, for example, in that point of the action plan about prioritization of risks, that is crucially important. Countries don't have resources to do absolutely everything. So it's super important that countries can prioritize what are the highest risks, what are the most exposed and most vulnerable populations, and how do we need to prioritize the use of resources to ensure that we're protecting those that are most at risk. Now, that risk assessment needs to be very rigorously made. We need to ensure that we have sound metrics and that we have very robust steering systems to understand what we're going to prioritize to ensure that no one is left behind and to ensure that we're reaching the most vulnerable communities as well. In that sense, we discussed being able to not only set the risk with metrics, with very clear thresholds, but also set what is our level of acceptable risk. And when we look at risks, it's not about the risk today, because those impacts are already happening. When we talk about adaptation, we need to be forward-looking. What do we need to be preparing for? So there's a need to incorporate also an element of the temporal dimension, but also the different challenges that we will be facing in different mitigation scenarios. We need to be preparing and adapting to a 1.5 or 2 degree world in the future, but we also need to be cognizant that we're currently heading to 3.7 degrees that will be catastrophic. So what does that look like, and how do we need to be preparing to those future heating scenarios? How can governments incorporate the knowledge of risk assessment to be able to provide an adequate response? And importantly to that, in the prioritization, the high priority risks under a 2 degree scenario are very different to the high priority risks under a 3.7 degree scenario. So we cannot lose track of the importance of mitigation and that temporal dimension that we need to look at when we identify the risks. Finally, we also discussed what do we do once we've identified them. Once we've identified the risks, what are thresholds for response? And there is where the process of what we do with that information is crucial. What happens when we exceeded a level of expected risk? How does the government need to respond in terms of tackling that risk? How can those levels of risk trigger emergency units that work across departments and bypass the bureaucracy of who owns each fictionally separated sector of government? How can we ensure that we are acting in emergency mode when the risk requires so? And how can we ensure that there's very robust and very clearly defined and ring-fenced financial support to respond adequately once those risks are reached? We also discussed a bit about the importance of ensuring that this action plan really helps us say that we've achieved something very meaningful in this COP. And in that, we need to take into account that we already have some work going on in the UNFCCC with the Global Goal on Adaptation. The WHO has its action plan. So we need to be looking at this very much in depth and understanding what is the added value and how can we best take advantage of this huge opportunity to claim a huge success from the documents coming out this COP. How can we ensure it's complementary to those other efforts, and how can we ensure that it takes us one step forward to implementing the action needed to protect populations? I'll stop there.
Brilliant. Thank you very much, Marina. Okay, great. So the next working group is Working Group 2, Evidence-Based Policy Strategy and Capacity Building, and Danielle Boos from PAHO is going to talk us through.
Thank you, Alan, very much. Thank you also to the government of Brazil for the opportunity of and the honor to be facilitating that working group. Maybe I'll speak a little bit trying to support and to improve the Belém Health Action Plan on some of the challenges that we see with this working group. I think that it addresses some of the what should be done, but it talks a lot on how things should be performed and implemented. And perhaps there might be a bit of confusing processes in these 8 topics that are proposed, because some of them, like the health co-benefits, so we do have the tools, we do have the the ability and the technology to start doing so, but some of them talk about the hows. And the hows should be implemented throughout all the activities and not just what's encapsulated in Working Group 2. So maybe these, we're going to need a specific framework to understand what are the activities that are being proposed and what are the mechanisms and the ways that things should be done across the Belém Health Action Plan. So that was an initial a challenge that we identified. And we discussed, to give you an example of the 8 topics that we have, one on discussing a specific terminology on climate and health and the difficulties of translating that not only to different languages, but also climate change is a very technical terminology. It has its own world of language, specific technical language that is not accessible for everyone. And that's a way of excluding people from participating in the decision-making, in the and in the implementation and in the monitoring. So in these 3 big processes that I think that we need to focus is how to implement the policies, how to implement the activities, how to design them in the first place, then how to implement guaranteeing that we have social participation, that we are addressing the needs of everyone, and on monitoring using the health equity lens to see if progress are being made to close the gaps of who need the most and not, like Mauricio very elegantly mentioned in his comments before, we are not inadvertently increasing the differences between groups and between what we are aiming to deliver. So we do have a very difficult terminology in the climate change world. What's resilience? And I think it's very important that now we are talking about the GGA and then defining what climate resilient health systems are. But what are health co-benefits from climate action? You know, so it's a whole new lingo for people who are not used to that. So we're going to need specific guidelines that tell us exactly what do we mean when we mean those things. We are recently discussing a resolution at PAHO, and countries raised their hands and said, climate justice is fine, but we don't know what it is. We don't know how to measure, so how can we incorporate that concept into a resolution? So we still need a lot of work to do into cleaning that terminology to be able to advance with measurable elements as well to see if we are closing the gaps that we are pointing out in the first place that we need to close. Then we had a very rich discussion on capacity building. We had a lot of energy in the room, people really wanting to continue to discuss. I think that will go on until the very last day of COP. Initially, we will focus on health professionals, which is fine, on the concepts, but most of all on practical terms. So we need to have instruments for health professionals at the local level as possible, so community workers also understand what are the implications of climate change so they can act on that. First, on prevention, so we need the risk communication. A lot of things that Marina mentioned is very important for our group as well, so how risk is defined, etc., but also how risk is communicated and to whom to trigger action. And we are seeing, and we heard, that now we are already in a point where medical professionals, they say, Daniel, that's great that we have all these early warning systems, but we are flooded with warnings of a dengue outbreak together with a hurricane, with a flooding and a drought coming in the other part of the country, and I have a team of 10 people, 5 people, 15 people. What do I do with all these warnings? How to prioritize action? And this bottleneck is key because health, and I'm talking health, not only the health professionals, but health determining sectors as well that can promote health or can impact health, transportation, energy, agriculture, etc. We are facing so many challenges at the same time that it's being difficult to prioritize to whom and what are the most efficient measures and actions to take to be able to reduce risk to most of the populations, or a differentiated reduction of risks to the ones that are at most need, who are usually affected by compound effects right? The same people that are affected without clean water, they don't have clean air, they have poor housing, they don't have access to health services, and they, on top of all that, climate change is exacerbating the conditions for them. So also there's climate change creates new challenges as, you know, vectors are more frequent in new areas, they are changing their behavior, pathogens are also changing and speeding up their life cycles, everything that we know. But more than anything, climate change is exacerbating the impacts of existing deficiencies. So lifting these populations, reducing poverty, delivering better services for them on water, on sanitation, on housing, on education is a way of increasing resilience in the first place. So these communities are stronger to cope with the additional impacts of climate change. But all of these aspects, when we prepare a proposal for the Green Climate Fund, they say, what is the climate rationale? Well, the climate rationale is having more resilient communities. That should be enough, in a way, of tackling as well the additional risks of climate change, and we need to do better in that area as well. So capacity building also focus on the next group of discussions that we had on health co-benefit tools. We do have those tools, but we need really to make sure that in the early development of all these implementations, actions, and activities, that we have social participation, that communities are being heard, that the needs of the ones that are being affected are being heard, and that they are part of the implementation process. That's also not very common, and we need to have some measurement to guarantee that communities and the ones that are being affected and multi-stakeholder groups are participating in the development and implementation of these processes, and that the monitoring of the success of the activities are using a health equity lens to see if for multiple groups we are closing the gaps that are needed. And for that, investment should go as local as possible, because then you can focus on a problem-solving approach and addressing the risks that exist at the local level. So last point is that, and probably another challenge that we have is that it was focused, we have a policy that is focused on gender-responsive actions. And there is a item that says policies for people with disabilities. The group started discussing, what about children? And what about race and ethnicity? So the intersectionality perhaps should be an underlying approach, that we should have clear guidance on how to incorporate, guarantee participation in the implementation, and measure the success or not of these implementations through an intersectional way. Because otherwise, we run the risk of disaggregating too much and then focusing on the disabilities and the topic of disabilities and focusing on the gender and the topic of gender and not really integrating all these intersection in every single action of the Belém Health Action Plan.
Brilliant. Thank you very much, Daniel. Could we have another microphone just so we don't have to pass it backwards and forwards? Right, thank you. That was great. Thank you very much. Okay, now working group 3, which was on innovation and production, and we have Vincent Breton from Unitaid to present some thoughts. Thank you.
Thank you so much, Alan. Good morning, everyone. So I've already reported part of the working group discussions focusing on the first elements around line action 3 related to infrastructure resilience, related to the integration of climate in health policies. So I'm not going to cover that today, but I'm going to speak about the additional elements which we discussed yesterday, which relate to, number one, the types of evidence that we need to demonstrate the impact of health adaptation measures that are being taken, and secondly, how to ensure that this is all done with a just transition approach. So starting with evidence, I think there's several interesting points that came up, and I think they can contribute to both making the plan more specific in places and also more ambitious in terms of the type of evidence that we're looking at. One first question is, what do we use evidence for? obviously to inform policies, but one use case that came up in the conversation that I find really interesting is using evidence to also advocate to the public about the relevance of intervention. One example of that would be air pollution in cities. Some measures are maybe not popular, and you need to explain the health benefits of those measures such that the public can become more supportive. That's a use case that is different to speaking to a ministry and having a policy decision after that. Then a lot of interesting points around the type of evidence that is useful. So of course there's the evidence coming from vulnerability assessment, coming from the assessment of climate events and climate impact already on populations. That in itself is important. Quantitative information, also qualitative information. Stories, human stories. Several were mentioned in case studies. The impact of those human stories, single human stories, is tremendous. And so we must not forget, while we look at impacts from a quantitative standpoint, that those stories are also really, really important. Some also evidence around the types of interventions that are being deployed. There were really interesting case studies around looking at what type of adaptation is put in place in different countries, facing flooding, facing extreme heat. And those types of interventions vary. In some cases, there's a lot of focus on supply-side intervention. In some cases, more focus on demand-side intervention. That knowledge is also extremely relevant. Two suggestions as well coming around. One, mitigation and adaptation. So even though we're talking about adaptation measures, those measures have an impact on adaptation, but also potentially an impact in terms of mitigation, positive or negative. And in some countries that were describing their own approaches, they said they always look at those two impacts. They would not make a policy decision without having both the adaptation and mitigation assessment of a potential climate policy in the health sector, which I find quite interesting as a lens to take and potentially relevant to consider as part of the action plan. Another consideration, and I think you were touching on that in group 2, is we're looking in the health action plan right now, the impact on health climate policies. But there's a health impact of other climate policies, which can be positive or can be negative, and we have maladaptation examples as well. And so there's a consideration of whether the action plan, the Belém action plan, would want to consider as well that broader health impact of other policies as a priority for health ministries to monitor, to measure, and to consider to inform those broader policies. In terms of generation of evidence, I think there's recognition that there's a broad range of sources, a broad range of data. I think you've touched on that also working group 1. So climate data, health data, meteorological data, sources that often don't speak to each other. So the challenge of integration, obviously. But also the question of that data, the routine data, surveillance data, may not be enough to demonstrate what we need in terms of the impact of health policies, in health and climate policies. So the need for bespoke monitoring and evaluation systems, the need for evaluation approaches as well, qualitative approaches, key informant interviews, and hearing the voices of beneficiaries to assess properly policies, and then specific studies and research, obviously, to make those assessments. In terms of methods, some really good examples came up more from the mitigation side, which, at least in our conversation, felt like a more mature space in terms of the tools available to assess mitigation impact, less so on the adaptation side. Some interesting comments around the use of modeling, which of course is a very important tool when it comes to policy making, but has limitation. And one example I was given was, if you're a city like the city of Paris, you want to understand the impact of air pollution measures, modeling can give you some answers, but if you need to convince the general public of the value of those measures, modeling is not enough. You'll need real data, and so where is this data coming from? How do you collect it? And you're back to the systems you need to make that assessment. Some interesting comments as well from coming from Brazil, and following the flooding event in the south of the country last year, realizing that many ministries, many sectors were trying to collect information after the flooding around what happened, and sometimes overlapping information. The same information was being asked by different ministries, different teams. So how do we integrate more the collective information, especially for health systems that have been going through a difficult period? Let me shift to the last conversation we had, which was around just transition. And one interesting consideration was around the types of interventions that are deployed in adaptation, and the fact that oftentimes, at least in some of the case studies that were shared, the adaptation measures are doing more of what we already do. So there is an extreme climate event, let's put more resources, more staff to deliver the same services that we're used to deliver in those areas. And then at the other extreme of the spectrum, the most impactful interventions will be interventions that redesign the goals, the visions, the principle, the distribution of power of those health services. And those happen to be interventions that we see less in the response of health systems to extreme climate events. One example that came up multiple times in our conversation is the example of mental health. And I'll share one illustration of that. In West Africa, when there's flooding episodes or heavy rain and the rainy season is coming up, people might be sleeping in their home and actually not sleeping from the fear and anxiety that their home might just fall apart because of potential flooding or be just simply flooded. And so the mental health of those people becomes a key consideration, but the traditional response to flooding may not look at all at that angle if it doesn't consider the social participation of the communities to understand really what are their needs. Finally, and I think you were touching on that, Daniel, a few minutes ago, the voices of communities, but also the fact that the strengths, but also the weaknesses of the existing systems and the vulnerabilities of the systems get exacerbated by climate events. So if you have systems with community health workers that are effective, that's a strong basis for response. If on the contrary you have systems where the voices of communities, the voices of women, for instance, are underrepresented, that becomes an even greater challenge in the case of extreme climate events. Similarly, social protection systems, if those systems already account for vulnerabilities in response to climate events, that's going to be a strength, and gaps otherwise would just be exacerbated. I'll stop here, time is over, but lots of responses, lots of feedback, and also online contribution that we can leverage further. Thank you.
Brilliant. Thank you very much. So I think that was not easy. So I think it's fantastic. Thank you all for doing that, because that was a very challenging task that we were set by. You were set, not me. You were set by Dr. Agnes. If there's time at the end, I'm going to come back to you, because we were set some homework by Agnes, which was to identify some solutions that we could move forward into the Belém Action Plan. So if you can just put your hats on again and think very carefully if there's time at the end to do that, that would be great. Okay, so we're now moving into the next bit of this session, which is going to look at these two supporting documents that will be produced in advance of COP30 to support the Belém Health Action Plan. And the first one of those is on evidence for policy, and that is going to be presented now by Nick Watts. Over to you, Nick.
Hello, everybody. How are we? There you go. Now we're awake, eh? Sorry about that. My name is Nick. Can you put your hand up for me if you have a phone in your pocket or in your hands? I mean, I know all of you are lying. Put your hand up. I want you to go and take the camera in your phone and fill out that QR code there, and it has some really simple questions. But God, we need your help. Okay? If you ask the British Medical Journal, they will tell you the first article published ever on climate change and health was in 1988. If you ask the Lancet, they will say nonsense. It was published in the Lancet in 1991. I'll leave you guys to go and figure out which of the two is right. I first got involved in this space a little while ago, Bali in Indonesia, COP13 in 2007 was the first of these things that I showed up in. And back then, you could count the number of people that would come to a health and climate change conference on half a hand. We were a small community there. There were people working in countries doing impressive hard work. The WHO, God, has been here that entire time. But it's worth stopping for a second and reflecting on how cool it is that we are all here, on how impressive it is that we have over that time moved from a world that was all about advocacy and all about trying to create the science just to convince people that it was worth acting, into the colder, harder world of delivery. The problem wasn't that the health ministries weren't showing up at these events. The problem was that the health ministries didn't have jobs. There weren't chief sustainability officers. There weren't chief environmental officers inside health ministries. And now, everywhere you look, there are. This world has changed fundamentally. As it has, we've gained frameworks and new ways of thinking about this. That original operational framework from the WHO 10, 15 years ago on resilience now evolved into the wheel that we see again and again. We've gained new entrants, the work from the Asian Development Bank and the CHI, from the World Bank. Tama somewhere with this exciting work on best buys that's coming up sometime very, very soon. The Lancet Countdown, the Pathfinder Initiative at LSHTM. It's become really quite cool. We've moved from Glasgow with ATACH, Sharm el-Sheikh, where we learned about the importance of moving together for implementation. I don't know if people remember that slogan, into, was it Baku was in solidarity for a green world, Dubai, and now Belém. You can see what I'm doing here. I'm not going to tell you about what is going to be in this special report from the Brazilian presidency on evidence into policy, because it's not written yet. That's what we need you guys for. That's what the last 3 days of this conference have been about. It's what the 87,000 words worth of submissions of evidence that have come through from everyone here, 107 organizations, 87,000 words worth of evidence that has been submitted back in March, April, and May, the discussions that started back in January, but importantly, the discussions that started all the way back in 1988 or 1991, depending on who you ask, and all of the different, really quite cool things that everyone is doing. And everyone has been filling out this QR code, is that right? What ends up in this special report is up to you. I have a couple of thoughts. Firstly, we have heard a lot from some pretty smart people over here to my left that the evidence is not quite as good as we need it to be. We agree. But we need to make sure that that lack of evidence doesn't paralyze us. You need to have, obviously, that two-track, the ability to run at two different speeds. What can you do now? What can you just get on with, for God's sake? And where do we need to try some things, evaluate, and then improve? What can we do by ourselves? The health profession, the healthcare system, a healthcare system is an ungodly, big, powerful actor in a country. We've got, often within government, we are the most powerful agency there. We just don't always know how to use that power because we're often a little too big, which sometimes makes us a little bit slow. But God, there's a lot we can do by ourselves. What do we need help with? Where do we need to turn to our friends in energy and transport and say, God, we need to make sure you keep the lights on, but we need to make sure that as you keep the lights on, the power that is keeping those lights on is lower carbon, because our team is dying out there and we could do with a little bit of help. Those two tracks, figuring out what we can do ourselves, what we need some help with, that's clearly important. I think most important is that we need to make sure that this is fun. This stuff is hard. It's pretty tiring. I'm pretty tired. I'm sure you can tell. We've been a community for a long time, and it's a growing community, and we need to make sure that as we grow, we're having fun and learning from each other and smiling each time, because we have to keep playing this game year after year after year. After Belém comes, question mark. I saw the Australian in the crowd very quickly look up. I saw someone from Turkey very quickly look up. We have to make sure we're ready for that. So listen, this QR code asks some pretty simple questions. What's a really cool idea you've heard? Something that made you go, wow, I hadn't heard about that, I hadn't thought about that. Something novel. I don't want to hear every country should have a national adaptation plan. We know that. We want to hear a little bit about what you wanted to hear more of. What did you hear, but you go, God, I wanted to double click in on that and hear a little bit more. How do we expand on that throughout this special report? And then finally, tell us about some cool stuff you're doing yourself. Tell us about some cool stuff you're doing at home. Tell us why it isn't working. Tell us what you're going to do to make it better. If you can manage those two tracks, if we can manage to figure out what we have to do ourselves and what we need help with, and if we can have a little bit of fun, and fourth and finally, if we can have a little bit of hope and a little bit of optimism. My favorite part, I was speaking to a friend of all of ours, Jenny Miller, who couldn't be here in the end, but I spoke to her on the phone yesterday, and she said, what's it like? And I said, it's really hopeful. This space for the last 6 months or so, for the last year or so, has felt a little bit hard, and I don't feel any of that emotion here. I feel people feeling quite optimistic, and it's really nice. If we can manage that, then absolutely, I've got some hope that we can fulfill on some of those slightly insane slogans and promises like Together for Implementation and In Solidarity for a Green World and Act, Deliver, Implement, I think. I'm really excited to hear what everyone thinks. Thank you very, very much.
I apologize that when I introduced Nick, I didn't tell you he was Australian, but you can't do everything. Okay, thank you, Nick. Right, so we're now going to have an introduction to the second supporting document, which is on governance with social participation, and I'm going to hand over to Romulo Paes from the Brazilian Association of Collective Health, Abaixo.
Thank you. Bom dia a todas e todos.
Good morning to all of you. I'd like to greet in Portuguese, and I hope it is duly translated to the languages. I hope you feel welcome. I hope Brazil and Brasilia is treating you with lots of hospitality. Our task is the production of a document on governance with social participation. Next. I don't have the pointer, thank you. So here you can observe who are the people involved and the institutions involved. So we have Abaixo, the Brazilian Association of Collective Health, Ministry of Health, and IDS, and Brighton. Our point of departure is the perception of this inequality, asymmetric inequality, the regions, the countries, the populations, which produce the biggest risk and damage related to climate change and climate crisis, which we see today, have been feeling and experiencing the consequences of this type of intervention. So this is our point of departure, and of course, what we are accumulating in terms of evidences concerning climate change and the impacts on health, and also things that we are getting acquainted with, not only respiratory disease, mental health disease, cardiovascular diseases, but also other knowledge which is connected to the effects of the environment on health. So our objective, therefore, is to produce this input and this document, which will inform the action plan of Belém. And obviously, due to this, we intend to go through the various possibilities of consultation, which begin here in this very moment. So I will thank you that at the end, please copy the QR code in order for you to be able to send us your valuable contributions. And we will also do this taking into consideration your different viewpoints, your different experiences of different populations, cultures, to see how each one are tackling climate change so that we can convert this to public policies. So our point of departure, therefore, is that there's a fundamental contribution of communities, of traditional peoples, which they can bring to the planet when we produce public policies to face this complex problem. And this is why we would like that this contribution have a voice, not only obviously during the Belém conference, but also that it have a voice in the daily lives of the production and elaboration of public policies in the rationale of production and consumption in our planet. And for this to happen, we have an understanding that the participation, social participation, is essential in order for us to have effectiveness in the design, in the implementation phase, and evaluation of public policies. And this is of vital importance to have a more general and a more plural view of a democratic society. And this is why we understand that social participation, and we understood this as we studied the theme, it varies a lot throughout the countries and throughout the communities, especially in the relation between civil society and governments. And so in order to enable and foster participative organization, fostering dialogue based on respect and based on inclusion of voices which have been silenced in the past, in order for us to improve our approach and our way of dealing with natural resources, producing better well-being for all. So this involvement, broad involvement of stakeholders, is fundamental in order for us to face simultaneous crises we are facing. And therefore, it is important to have develop an institutionalized manner of implementing this. So I will pass the floor to Lucia Xavier. She will complement the presentation. Thank you very much, Romulo. Good morning to all of you. We also would like to share an experience we went through in Brazil thanks to the construction of a system which enables and obliges social participation as a fundamental key element, not only to enable accountability of systems, but also to enable the perfectioning and the polishing of a system which is more equitable, just full of justice in a country like our own, which is a country with very serious social, gender, and racial inequity and inequality. So based on the Brazilian experience, we brought this key element which aims to increase social participation, elaborating a participatory system. And we hope this will be a stimulating element which will foster the action plan, the Belém Action Plan, and make sure it mirrors these different viewpoints. We have different participative councils of all levels of governments and NGOs which aim to establish objectives, goals, guidelines, so that Brazilian governance will manage to support itself upon healthcare policies. And due to the continental dimensions of our country and the capacity of dialoguing with different biomes, different communities, different social, ethnical, racial groups and communities which are full of possibilities when we're speaking about amplifying Brazilian democracy. This perspective can also be found in other countries with a smaller or bigger emphasis, and they can help us to rethink what we are going through and what we can manage to construct as a participative process which aim to face climate change and constructing this strategy of mitigation, of resilience, of a system that needs to look to healthcare issues as key, not only how to face and how to tackle climate change, but how to tackle crises. And this is why there are 2 points that I would like to outline in this discussion and that could bring new elements to our analysis. The first point has to do with participatory vigilance of healthcare, and the fact that they need to consider the different levels of engagement and commitment, not only by the affected groups, but also the groups that have potential capacity of investing in solutions. So the objective is to produce information and actions which aim to protect livelihoods. Then there's also the social participation dimension, which can contribute to innovation. But innovation is not an exclusive process led by markets. Communities also have a long transition in the development of solutions which will be very useful to all of us in any part of the world, considering that the Belém Action Plan is thinking on global health. Finally, we believe that our contribution needs to be validated. We will begin to speak internally and analyze internally the Brazilian structures of participative process, and we believe that all countries, the committees, the communities, and all the processes that aim to validate the results of COP30 and also validate the action plans involved in the structure need to be better heard. Not only better heard, but the population needs to be heard. Communities need to be heard, communities which suffer the impacts in a heavier manner. And this is why our idea is that this dimension needs to take a small first step, steps which will grow throughout time and which will give us concrete results. And this is open to any country which intends to aggregate social participation within their structures and make sure that the results of adaptation and mitigation and resilience in health and climate be successful. Finally, I'd like to thank the possibility of being here and remind you that we have a QR code on our screen in order for you to help with your own contributions. It's fundamental that you give your opinions and ideas on this process. Thank you. Just to conclude, we would kindly request you, since we're asking for your opinions, please send your contributions until September 15th so that they can be considered in the elaboration of this document. Thank you.
September the 15th is a very important day. It's my birthday, but otherwise it's... I wanted to just say a couple of things. So I think, just on social participation, Welcome and a few other funders have supported a Global Citizens Assembly, which is going to be a massive undertaking, there'll be some presence at COP30, but then there'll be significant work bringing together global views on climate change and climate and health for COP31, definitely. So I will link you with that immediately. But more broadly, I think we're seeing here the two papers that are going to be produced in time for COP30, which is now 100 days away. And I think you've heard that we have a role to play to support the production of these documents. And I think you've heard that the teams, as brilliant as they are, really could do with some support. So please do follow those QR codes and please do provide input to help these documents be as good as they can. And this is yet another example of Mundial, this idea that we should all be participating and supporting each other to deliver. So thank you for those two. Given the time, I'm going to hand straight over to Dr. Agnes to give us some closing thoughts rather than have a Q&A, and then we can close up. So Dr. Agnes, over to you. Thank you.
Okay, thank you. So I think I'm feeling the weight on my shoulders because I think everyone here has a question to this group. But I would like to start with something that just came to my mind listening to this morning's sessions, but thinking on all the other sessions and the working groups that I've managed to see, I wish I could have seen all of them. And I apologize, but I'll say it in Portuguese now.
We have an author, a Brazilian author, called Machado de Assis. For me, he's the best Brazilian writer. And he has been translated in many languages. And I even saw his book was translated to Dutch. And there's even a Machado de Assis Day, National Day in Holland. So I believe he is relatively well known in the Netherlands. And so the first time I saw this, I thought it kind of funny. And one of the most famous books called Dom Casmurro, there is one of the characters where he uses adjectives and superlatives to show the monumental ideas. And he says very elaborated and long sentences and different expressions. He invents expressions. And he says that he uses all this to hide the superficiality of his ideas. So what I heard here is that let's be careful not to go into this same risk. We're speaking about sensational ideas of social participation, climate justice, how to promote inclusion, how to develop problems and solutions. But if we don't manage to translate this, because what we heard from groups, from presentations, and even in the words of the funders, we have to ask ourselves, what do we want? Because if we do not manage to gather what we took down wrote down in the plan and translate this into concrete actions, this document will be superficial and void. So we really need to develop this very concrete plan. This is a collective construction for a very simple reason. We deal with a complex problem, as a matter of fact. And since it is a complex problem, depending on the location you are, you will have a different response. And this is why we need to see what are the actions which will make a difference, and that as we work collectively, we will manage to change history. I know it is a major challenge, but it's a calling that today we are able to respond to this calling, and we have put this challenge towards us and for us because we believe that there is maturity in this moment for us to execute these actions. And it was very clearly said, all this was said. Nothing here is like everybody knows about this. It's nothing new. And there's no need of discuss health and climate change and its effects and consequences. But what we need to do now, and I heard this very clearly from the behalf of all of you, is to transform these ideas into concrete actions. So we need to see how we will assure that these ideas will be duly implemented in society, in the decision-making process, and they will make a difference. So the opportunity we have of presenting these proposals, presenting our ideas clearly during COP30, and all this has been conquered. Nothing was given for free. We had to struggle for this achievement. So how are we going to do this? And the only way, what is the way we will manage to reach this goal? And we still have this afternoon to work together. How we will act, what we will choose as a global priority, which will make a difference. And we saw this very clearly, that there isn't a sole response, a sole solution to foster participation and equity, because we need to know our own realities, our own circumstances on a national level in order to make sure we will promote change. We are not able to change something that we are not familiar with. And so if you are already know the base, and if you do not manage to resolve basic issues, you do not manage to work with adaptation. So how to translate this and prioritize what should be funded, what is our responsibility as healthcare sector. So we need to separate what we need to do and from what is not priority. And sometimes what you need to do is show the impact of public policies and what their impact is on health. But this is not enough. Some things only we are able to do, like elaborate responses for adaptation, which aim to save lives. Make sure we keep on struggling, that we don't give up, that we manage to reduce emissions, so that at some point, so that we don't ever reach this turning point. And for this to happen, we really need this collective effort. So I'd like to congratulate the working groups, those who are working hard and making concentrated efforts. We have in very little time, but this is the window of opportunity we have here. So thank you to all of you who accepted the challenge. I am sure we will manage to produce very concrete results and that we are be part of history in the moment that we are using and aggregating our experiences. So if we manage to put one paragraph on health in the Paris Agreement, so I believe we do have the conditions to do this. Thank you very much.
I'm going to do something off script, which is I'm going to ask you if you have any questions. It's easier, then I don't have to think them up. Right, so I'm going to come around and I've got the microphone. I'm going to pass it. I'm going to collect 3 or 4 questions. Please put your hand up now, and then we'll see what the panel have to say. I didn't tell you I was going to do this, but let's see what happens. Okay? You did? Okay, brilliant. Right, put your hands up if you want a question. There's one over there. So we'll collect 3 or 4 questions, and then 3 or 4 questions, and then we'll come back. Okay, let's go. And if we can keep, they're not presentations, they're questions.
Yes, thank you. This is in fact the first opportunity that we can speak up during plenary sessions.
That's what I thought.
Much appreciated, thank you. I have a very simple question. Can you please specify in all details again on what the 2 additional papers are and what the deadlines is and what the procedures are? We will receive email information, all of those that are listed, etc.
Super.
I'm sorry I'm not seeing that clearly yet.
Thank you. Next question.
Thank you very much. Alô? Olá, eu sou Camila.
Hi, my name is Camila Aragon, and I would like to ask about the lack of excitement, let's put it this way. I myself, I live and I feel that in my territory we are really impacted by the climate changes, and this is, for me, it is a cause of desperation. We are being killed by the climate changes. We're being impacted by multiple ways. I'm a professional of healthcare. In my territory where I live and I work, we are being impacted by climate changes in a way that is perverse. And by knowing that we are not the ones who are polluting alone, we are not the ones destroying, right? The opposite of that, we are working in order to preserve, in order to get rid of pollution. So this is a context of desperation, of sadness for us. We are seeing that the future is repeating the past. We do not have novelties. There's only desperation. However, I believe that we can change and that we can have a better future, a better world. If we can exchange information, if we participate in this transformation. Maybe that's why we are not excited, because there's lack of experience changing. Thank you.
Next question.
Mais? Yeah, thank you very much. A lot has been digested and presented for the past days. Will there be a link to help us have access to all these reports? Thank you.
Thank you. Final question. There's one here in the front.
Minuto.
Is it on? Yep. So my question is very simple. How do we use the Belém Health Action Plan to get non-health people talking about health?
Not working.
Okay, no, it was working. So the question was, how do we get the Belém Action Plan to get non-health people working on health? Okay, good.
Okay, so sorry, just to repeat. How do we get non-health people to talk about health, and we use the Belém Health Action Plan as a vehicle to do that? How do you think we should do that?
Brilliant. Okay, so we've had four, that's all we have time for, I've been very clearly told. So let's go with this. So, of course, I'm not expecting every panelist to answer every single question, because that would be madness. If you would like to answer one of those questions, so there's two questions which are logistic, which I think will come to Dr. Agnes, if I may. So one question about I've been told no, sorry. One question about the supplementary papers, another question about the link to all the products and outputs that were produced, has been produced. And then we had a very clear statement from the lady in the corner about the need for indigenous voices, the need to hear more, and the desperation of some communities, increasing numbers of communities. And then finally, how do we involve non-health actors? So that's roughly what I heard. Dr. Agnes, if I could come to you very first. Have we got a microphone? Brilliant.
Okay, very quick. The timeline is we need to produce, these are the supporting documents. So we have the Belém Action Plan. We cannot put everything in the plan. The plan is like giving the framework. So the documents would say, if we talk about evidence, these are the policies we know that are, you can call it anything, best buys, but what are the policies we know that have an effect, and not necessarily the way you measure normally assessing impact with systematic reviews, because they may not be there, but what we know about it. And so it's like a menu of options that we could have. And that's the reason we need to collect from everything. And we've heard how much is being produced, what can be could be done at a great scale, it's ready to go, or that we know could be done in a short term in terms of results. And the other paper on participation is, if we are talking, it's so important and it's needed not only for the evidence, but if we want to work on equity. So what does it mean and how to start in collecting the information, giving the framework to do that? So what we'll have is, by September and by the General Assembly, we should have at least the first draft of the documents. And by COP30, when we deliver the Belém Action Plan, and we hope to have endorsement, and I believe we will have from the things we've heard here in the conference, then we have also the presentation of the documents. The process, I think the links they gave is the way to participate in this process. Some people will be invited to review, and we'll have, this will be, I think, open for some time. But that's the process. So we have a short time. Not everyone, we cannot receive, I don't know, 5,000 contributions and be able to include, but if you do have great ideas, and just make sure you use this channel as soon as possible, I mean by tomorrow or so, and that's it.
Thank you. Thank you very much. And I wonder if I could ask Romulo or Lucia to answer the question on the specific question on on social participation from the lady in the corner. Just if you want to make a comment.
There is a singular moment that we just started when it comes to COP30, which is the possibility of having a social participation in the process of making the COP30 final document and the consultation as well. There is a historical possibility here, an opportunity for us to have a document containing a contribution in terms of social participation and also a presence of the society in the public policies. And therefore, we can work with the evidences that we have, with the history and experiences that we have, and an intense militance, or in other words, a social participation that is of paramount importance. And it is important for us to comprehend that COP30 is singular, is of paramount importance, but with limitations. We need an agreement, right? A global agreement. We need to have to improve public policies in terms of environment, health, and climate in the world. However, we need a continuous action, pre-COP, during the COP, and post-COP. So COP30, for us Brazilians, is a calling moment. We are calling people in order to put on the table whatever is needed, all the topics that are of paramount importance. So in terms of the commodities of agriculture in Brazil, etc., the farmers, they do not know, the perjury or the harms that they are doing sometimes, and they oppose to the COP30. In the executive power, in the legislative power, and in the judiciary power. And therefore, COP30 is a calling. And we need to take our voices to the pulpit. We need to put our needs on the table, and this is the militance part.
Thank you very much indeed. And if I can just have a final response from Marina on the question on non-health actors.
Yeah.
Quick response.
Thank you so much for that question. It's fundamental that we do include non-health systems here. And the issue is we have a huge opportunity because this is not World Health Assembly where we come together as a health community. This is the UNFCCC, and the owner there, the main actors there, are from the environment, from the climate sector. So we can directly engage with them if we take that into account. So when just thinking specifically about the action plan and restricting my answer to the action plan, we have very low-hanging fruits there in terms of the opportunities. One is the GGA has offered an opportunity to integrate adaptation as a crosscut and is one global goal on adaptation with different targets, of which health is one of them. All of the other targets are enormously health relevant. So incorporating the notions of how we will respond to the GGA and integrating those other sectors within this action plan allows us to speak directly to those other sectors that are also engaging. The other thing is, in the response from the health system, we are providing the care, we are providing the protection, the emergency response that all the other sectors also need to ensure they're in place. So we need to stop thinking about what other sectors, I'm going to sound like an American, I'm realizing, what other sectors can do for us, but what we can do for the other sectors as well, what you can do for them. I'm using the finger. But it's very important that we frame the health sector as the protector of health and the one that can deliver much of the actions that others also need to put forward within their action plans and find those opportunities for integration in ways that are mutually beneficial. So when we talk about an emergency response unit, and I've been engaging with the UK a lot with the Climate Change Committee, that emergency response unit has to have everyone on the table to provide solutions and to deliver to a common goal. So in thinking about this action plan, I think we do need to think about what is the role of the other sectors and how can the health sector contribute to advancing also the goals of the other sectors in ways that are truly cross-disciplinary. I don't know if that
Thank you.
answers.
That's great. So very briefly, Lucia?
Camila, não deveria ser eu a pessoa respondendo.
I shouldn't be the one responding this question, right? I'm an Afro-descendant. I represent the civil society, and I'd like to respond to your question. Ever since we started this event, there is a declaration of some of you that the climate changes are impacting those people in a significant way. They are in need, emerging need, and we need to take our actions to these groups, to the vulnerable groups, and to the impacted communities as soon as possible. And this is of paramount importance. Your declaration, your statement is really important for us not to handle the situation in a non-singular way. We have to singularize you. We have to put the situation in a unique way in order for us to bring about responses that are emergency responses, that are different responses, because there is a need, an ultimate need of being attended. So we need to be fast in your community and such like communities, right? We cannot act right without speed. We cannot discuss for a long period of time because you don't have time. So we have to be fast.
Session, and I just on behalf of Welcome, but also Rockefeller and Gates, I mean, I think we're all thrilled, and UK government and the other funders thrilled to have supported this meeting. It's really, really exciting to see. I think we have also seen the value of partnership. We have seen the value of us all working together. We must continue to support the Belém Health Action Plan as it develops and as it's delivered, and then in the following years as it rolls out and as it's implemented. I hope we can stand together as a community that recognizes how essential this is and that we all have a role to play. I'm going to now hand over to our Master of Ceremonies. Thank you all very much indeed.
Thank you, participants, for the contribution. One quickly total, please. Thank you very much. Senhoras e senhores,
ladies and gentlemen, would like to wrap up with this morning session. We will have the session 6 now. The participating processes in the COP30 will be moderated by Alice Marine Bogas, the Program Director of the COP30 Presidency. Welcome, Alice. And sequent to that, we will have a panel with representatives of multiple stakeholders, and we will invite them to have their perspective on COP30. We'd like to invite Mr. Ethel Maciel, Special Envoy for Health COP30 of the COP30 Presidency. And Joaquim Bello, Special Envoy for Amazon Civil Society COP30 Presidency. Sinea Duvali Wapishana, Special Envoy for Indigenous Peoples. Unfortunately, she's not here still, and we'd like to invite Mr. André Guimarães, Special Envoy for Civil Society.
A todos.
We'd like to invite you to watch the video of Dan Yoshpi of High Level Climate Champions for COP30, and this will be a video presented now. Thank you, dear colleagues, health ministers, COP special envoys, experts, innovators, and community leaders. Good morning. It is an honor to join this global conference on climate and health to participate at the session as the high-level climate champion for COP30, and together with the COP30 presidency, we are committed to advancing a shared vision in which climate action and public health understood as deeply interconnected systems. Our commitment is to ensure that no community is left behind. In the face of severe health impacts of climate changes, allow me to begin with the report of our country. As many of you may recall, last year my home region faced one of its most severe climate disasters. Floods in the state of Rio Grande do Sul displaced more than 500,000 people and did not give health commitment. And
os serviços de saúde de emergência operaram sob condições extremas, tratando doenças transmitidas pela água, enfrentando o trauma e o medo presentes nas comunidades atingidas. Essa realidade não é exclusiva do Brasil. Infelizmente, ela tem se tornado cada vez mais comum em diversas partes do mundo. Esse cenário evidencia por que não podemos mais tratar as questões climáticas e de saúde de forma isolada. Esta conferência constitui uma oportunidade essencial para criar soluções, assumir compromissos e impulsionar ações em prol de sistemas de saúde resilientes rumo à COP30 e além. Através do Climate Champions Team, temos testemunhado uma liderança inspiradora no setor de saúde. Mais de 70 instituições de saúde, representando mais de 14 mil hospitais e clínicas em 26 países, aderiram à campanha Race to Zero, adotando medidas concretas para reduzir emissões, descarbonizar operações e aprimorar a qualidade da atenção à saúde.
With the support of healthcare without harm, these institutions are reducing energy consumption, reducing emissions, and investing in sustainable supply chains, all with improved health outcomes as a priority. Under the Sharm el-Sheikh adaptation agenda, health is recognized as a strategic priority in building climate resilience. The agenda outlines a clear set of health and resilience solutions for 2030, aiming to ensure that people are protected from increasingly severe climate risks. These solutions include expanding universal health coverage informed by climate data, strengthening of infrastructure to withstand climate shocks, development of early warning systems that integrate health risks, scaling up training for the Climate and Health Emergency Workshop, and ensuring climate resilience issues. I would like to acknowledge and congratulate the World Health Organization and the International Federation of Red Cross and Red Crescent Societies, whose joint leadership in health within the context of Sharm has been fundamental in transforming these goals into concrete global action on a world level, aligning with global health agenda and aiming to mobilize the entire international community to support the implementation of the national adaptation plans and nationally determined contributions. They provide a clear roadmap for achieving global goal on adaptation and respond to the recommendations of the global stocktake. By implementing these solutions, we are not only building more resilient systems and saving lives, but also establishing health as a fundamental pillar on climate resilient changes. As Brazil prepares for hosting COP30 in Belém, we are acting with urgency and purpose. The COP30 presidency has laid out a clear roadmap through a series of 4 open letters addressed to parties and different stakeholders. These letters reaffirmed commitment to climate justice, inclusion, and large-scale implementation. In the 4th letter, the Climate Action Agenda was introduced, and with it the Objective 16 of the Action Agenda to ensure that health and well-being are integrated as central themes of climate action and climate resilient development. We invite everyone, health leaders, climate negotiators, frontline professionals, researchers, community leaders, and representatives of civil society to join efforts to ensure the realization of Objective 16 across all fronts, including through the Belém Action Health Plan. Partners and friends, by investing in resilience, we build trust. And by placing health at the heart of climate change, we build a better and more prosperous future for all. Let's continue together on the path towards more resilient health. Thank you very much. We will now pass the floor to our moderator, Alicia Amorim. Thank you very much. Good morning to all of you, ladies and gentlemen. It is a great pleasure for me to be here today. Unfortunately, I could not be here on the other days, but our director was here from the very beginning. Then we had Bruna Cerqueira from our Action Agenda team. And so I can guarantee to all of you that the COP presidency is fully committed to the cause and to the success of the Belém Action Plan and how healthcare is core within the COP process. It is also a pleasure to be here with our dear special envoyees who are a fundamental part of our organizational process for COP30 and for our ability to amplify technical abilities, the capacity of hearing the needs in different sectors, regions, territories, and for those who never participated in a COP before and the COP process, one of the main challenges of the COP presidency is to have a good listening structure, the capacity of hearing, of listening the different nuances, the different objectives, the different expectations of the different groups, and to manage to translate this the best way possible in concrete results in the process, which is, first of all, depends on 196 countries, those who signed the Paris Agreement, and all the stakeholders who are part of the solution. And this is not an easy thing to achieve. It's not trivial. And so at the same time, it's a great privilege and an honor as the presidency of COP of Brazil to build this process of COP based on a history of social participation and of valuing of active participation of society as a whole in the elaboration of public policies and international processes, as the G20 was the social G20, and I imagine that many of you actively participated in it. So having said this, it's important. I know that you're here deeply discussing many details, the action plan of Belém on health, but also it's important to bring a little bit of the perspective of COP30 as a whole and where social participation comes in, giving a macro viewpoint, showing challenges, opportunities that we have during a COP where we are facing a geopolitical challenge which cannot be despised, in a COP in which we are going through for the very first time a moment in which most of the items of negotiation of diplomatical negotiation, which is the core. Sorry, welcome, Sinea. Where the themes of negotiation which are brought to the table, which are at the very origin of COPs. And COPs were born to make feasible consensus and negotiation, and so amongst countries. And all this previously organized. So we do not have much autonomy. We can't simply innovate. We need to follow the guidelines. And so all this was built throughout decades, the 2 decades, since the Paris Agreement in the last 10 years, where we negotiated point by point, comma by point, comma, word by word on how to implement the Paris Agreement. So this COP is the beginning of a new era, of a new moment, in which we still have elements that need to be negotiated. However, the major delivery and the difference that a COP can do in people's lives is the capacity of implementing, of transforming what is an idea in a practical action. How can we work the construction of resilience and the decarbonization of economy in a way which is embedded in the core of the development models throughout the world? So this is not a small challenge. This means that we need to communicate in a better manner, in a more effective manner, that we have to better understand how the decision-making process is done according to the UN process. And at the same time, we need to communicate, we need to listen to the territory in order to understand up to what point these mechanisms, these political cues are needed to resolve things at the end of the day. So it's important when we reflect about social participation and all this beautiful process, an intense process that you're going through and participating, can this be inserted within COP30, but also in COP30, 31, 32, in the next 10 years? So all this process, maybe you are probably witnessing the beginning of a new phase, and the construction of this new phase depends essentially on the fact that it needs to make sense, and it needs to have the capacity of involving social participation. And so I believe nobody can be better than our special envoys to reflect upon how can we do this. What are the processes of participation make sense and can be incorporated? How can we innovate? And especially in the action plan, but also taking a look at beyond COP as a whole. So to begin this discussion, that I hope that you will also further contribute, and at the end we'll have a Q&A session, I would like to invite Ethel Maciel for her considerations. Thank you. Thank you very much, Alice. I would like to thank Ministry of Health, WHO, and all the partners for this opportunity to be here in the front. I will divide my speech in 2 parts. First of all, I'll speak about how and why did we reach this point, and also I'll speak about the near future and what we expect that will happen in the future. We arrived here with the new government of President Lula in 2023, where this agenda, environmental agenda, became a priority, a national priority. And we had, as CEO, the COP CEO mentioned, and Mrs. Anna Tony, we began from the very first day of office to work with the Ministry of Environment. So we developed different actions. We already knew we had COP, and we needed to prepare COP, Brazil to host a COP30. And so we had to develop and organize many issues and many points in the healthcare system in order to tackle the first challenge of the G20. And so we decided to put climate change and as a core of the actions in the G20, so that this could be the first movement for the healthcare sector, and we already had an analysis, which unfortunately our universities, our schools did not contemplate this issue of environment in their curriculums. So this is not part of the daily lives of our healthcare professionals. So we can not yet visualize the impacts of climate change in our sector. It is something which is flourishing right now at this very moment. And so this is why Agnes is working on the adaptation plan of our public healthcare system so that we can begin. President Lula reactivated the climate committee, and this was a major action that enabled us to increase this dialogue amongst the ministry. And until March, I was the Secretary of Surveillance, Safety, Health, and Environment. And so this participation in the G20, it was a very challenging experience because we thought things would be very simple and that we would convince everybody that climate has an impact on health and equity is important. And we were quite surprised to find that the major difficulty in this experience in elaborating an agreement with the G20, and that this was already like a training exercise for COP30 so that we can better understand how this consensus could be built. And so we had numerous difficulties, especially with certain words which are very important for us in Brazil, like social justice, gender, reproductive health, amongst others. And so we thought we would not manage to approve the declaration. There were many sleepless nights, but finally we managed to reach a consensus. And this consensus enabled us to reach COP29 with the idea that we wanted to reach. And I represented the Ministry of Health during COP29, signing the Baku Coalition, which mentioned the idea that we would have, that health would be something important to be discussed during the next COPs. So we began a group of actions, and in December of 2024, we organized a meeting with our partners who are here present, like Welcome, Gates Foundation, Abrasco, Fiocruz, Lancet, Rockefeller, WHO, and at that very moment, with the co-leadership of Minister Nisia, and I would like to recognize here her leadership here in this agenda in Brazil, Minister Nisia. And so we managed, thanks to this commitment, to insert this agenda in the G20. And we discussed at this moment what was our major objective, because we didn't simply want to sit together in a meeting and construct the Belém plan. We wanted to construct this collectively. So we launched this kickoff meeting, and we decided, Ministry Nisia decided we would organize this event with Tatiana in December of 2024. And so this is how we began to elaborate this agenda, which would start its implementation in March and finally in COP. So it is an agenda in progress, and this is what we are doing here. I'd also like to thank Minister of Health Padilla, which is very important to have this continuity. And so now I will speak about how this adaptation plan, it was constructed, it went through public consultation and will be launched. There are some indicators in this plan, and we see how healthcare professionals need to be trained. Here in Brazil, we are speaking about 4 million people, healthcare professionals, and 3 million of these people are nurses. And so there's also the community healthcare agents, and not all countries have this, and I will rapidly explain because this has to do with our agenda for the future. And so we had agents who worked to combat endemics. These agents visit people's houses to see whether there wasn't any potential risk for developing communicable diseases, dengue, amongst others. And they are connected to the Department of Health and Environment, and we understood that in the future these people were essential in order to comply to the commitments Brazil will assume. So all this is connected, and we managed to negotiate with states and municipalities, and in February of this year, a strategical guideline which aims to combat endemics. Was approved that healthcare professionals would work together towards this goal. So all this was done in order to prepare Brazil, with what needs to be done. I was trained as a nurse initially, and so we started working with the Brazilian Association of Nursing. And so we wanted to make sure that this need that we needed to put in the agenda be met. In other words, that these nurses be trained according to the new needs which were identified. And so with 350,000 hospital and philanthropical organizations. And this workshop was given to see how healthcare professionals could further prepare themselves to climate change. And so in Brazil, I was also had a meeting at the University of São Paulo to discuss the importance of having a chair of nursing, having participation of the National Nursing Council in this debate. And so the School of Nursing of the Department of Nursing of the University of São Paulo is actually a very important hub and for all this type of actions. And so it was important in the sense of helping us to construct what is ahead of us. And so I also invite other stakeholders, healthcare stakeholders, to participate this. So in Brazil, we have a gigantic personnel, and we need to train more than 50% of our professionals. And last year, actually, for the first time, together with PAHO, we managed to organize the first guide for healthcare professionals in the field of climate change, putting across this agenda for healthcare professionals. And so now we are currently going through phase 2, where we are preparing material for schools, for institutes and universities, in order for us to manage to effectively incorporate this important agenda of climate change and health in its curriculum, in its training, and in production of knowledge in Brazil. So my time is running out, but I'd like to say that I am available to collaborate with different institutions, with different associations, and all here in Brazil and around the world, so that we can manage to accelerate the progress in healthcare and climate change.
Thank you very much. I noticed multiple aspects of how COP30 can pretty much help you. And we can see now that COP30 is not only a meeting, a sole meeting in a week, and then it is all finished. No, COP30 is an observatory of knowledge, and it has a role of raising awareness of the population on the topics and the sensitive problems, and also bringing about the policies that are of paramount importance for us, and it accelerates the implementation of practices that are construed in order to mitigate the problems. And therefore we need the action plan is doing that. The objective is to bring about all of these topics to COP30 and how to continue with this action post COP30. So with that, I'll pass the floor to Joaquin. So how many events like this one you went to? more than 12, right? So you are experienced, you went through multiple processes. What are your perspectives on the social participation and how the society can participate in more, and how can we see more hear more the local voices? Good morning. I'd like to congratulate all the organizers for this event, and I'd like to thank you for the invitation. And this brings about topics of paramount importance. My name is Joaquim Bello, and I live in settlement in the middle of the forest, and I was born from a traditional midwife, and I've always lived in the same place. And I am working in a segment that has been struggling for the past 50 years for their freedom. Our community is struggling for our freedom. We have a slavery model that is persistent up to this day, and it is perpetrated through multiple methods. Let's put it this way. Ever since I was young, I've been struggling and fighting in order to reach our goals, in order to have our rights and to survive above all. I didn't have the opportunity to went through my undergrad program or any academic diploma, right, course. I went through multiple activities in the nature and the communities that are traditional, and this constructed high knowledge, a knowledge on the environment that can be useful in this context. And in this context, my place here in this event that talks about health is challenging and contradictory as well. When it comes to health, in a context of COP30, we live in a contradictory world. We have challenges on climate changes, current climate changes, and we'll always hear that these climate changes is a fruit of our behavior, is a fruit of a model that we have that destroys the planet. If this is fact, obviously the diseases are constructed by people as well, by the population. The diseases, the illnesses that are decimating populations, right, they are construed by the population as well. If it is construed by the system, we need a system to contradict that, to counter-arrest that, right? So our lesson here, we have an event with for descendants, with indigenous people, and so on and so forth. And we have this challenge, which is to understand the logic of the great capital, right? The great capital has constructed this population that destroys. And in this moment here in this plenary session, we are evaluating things, right? In order to come up with solution. And this very nation is constructing projects to destroy the climate, to destroy the environment. So COP30 is this environment with these two faces, with these two perspectives. We want to come up with the solutions of the problems that were construed by the very same population that is now wanting to coming up with solutions. So here in the COP30, we are talking about the excluded people, an excluded Amazon region, a racism, Amazon region. And this Amazon representatives who are racist, who are discriminatory most of the times, they will go to COP30 and they will declare that they are pro-solution. When it comes to drought, droughts and also crisis, we see that people, there are some communities that will depend on the climate conditions in order for them to survive, right? Because they plant their lives, and they might get destroyed tomorrow because of the climate changes. The very same thing applies to the Amazon region. Whoever studies about climate changes know that the climate changes is not uniform. It is varied. And therefore, multiple people will say that the project should be flexible to and adapted to each region. It should be adapted to the Amazon region, to the Acre region, to the other regions of the world. So this context of adaptation needs to be understood. And we need to understand that the model that presents a pack, a uniform pack that can be applied to everybody, is a lie. And they will continue to exclude people. This exclusion will kill people. And therefore, in this sense, this is a moment, a special moment that we live. We have to construct an alternative in terms of health in order to contour these problems. And we have to resolve the problems of health that we live. Now, in this current moment, the mercantilization, right, or the capitalization of health is attacking again. The health is being marketed or traded in the stock market. We have a price for health. And I understand that my life is priceless. But everybody's precified. Everything is precified now. And we need to detach ourselves to this precipitation. Life is not a stock exchange. And this is a challenge for us. We need to put in the agenda when we negotiate in the COP30 these diverse challenges. See, Maya knows that quite well. She is loaded with this responsibility as well. And I think that this responsibility here cannot go on my back alone or on Sinea's back alone. We need to share the challenge. We believe that we can stay in this planet, we can live in this planet in the future. And we cannot lose the trust on human beings. We need to trust, we need to believe that we will leave a good planet to the future generations. And in this context, you can count on the Ministry of Health, and we can communicate with the multiple stakeholders in order for us to put on the table solutions, come up with the solutions that we need. We need to talk to the Ministry of Environment and Ministry of Agriculture, of Indigenous Populations, of Planning, of Infrastructure, and so on and so forth. This communication is of paramount importance, and we have to gather all of those in order for them to help us. And I'd like to thank you for your invitation, and I'm wide open, my arms are wide open to receive you and to share experiences in order for us to have a better Amazon region. Thank you, and a better world. Thank you. Thank you very much, Joaquin. I'd like to highlight that this tension, right, this crisis is part of the process, and it is important for us to have this moment. We've been going through multiple COPs in the past 30 years, in the past 10 years, and one of the challenges is to know how we put the elephant in the room, the big thing in the room. And in this process that is highlighted by the North-South topic, right? The responsibility of the north towards the south country, we need to go through a process, some rights, right? And we have to manifest ourselves in the COP30. And the dispute is internal as well as external. And COP30 has to bring about these discussions to the table. And this is part of the process. The decision, the courageous decision of Lula to bring the COP30 to Belém is of paramount importance. This is part of the process. And it is good to have you with us as a special envoy to provoke us, to come up with questions daily in order for us to incorporate these provocations. Sinea, I'll pass the floor to you. You have multiple experiences. It's always know to pretty much see and understand your experiences with adaptation. You mentioned about experience with the care and adaptation of your program, which is useful for us to understand the solutions that are put on the table in order for us to make this process a little bit better. Thank you. Thank you. Good morning to all of you. My name is Sinea do Vale. My community, my indigenous community name is Wapichana, and the special envoy for indigenous peoples, and it is important to discuss about these topics. We have multiple people discussing about their experiences, about their demands, and the reality is that I have multiple experiences. I'm the coordinator of the territorial management sector of the Secretary of Cities of Roraima. Roraima is my state, and I coordinate the Indigenous Committee of Climate Changes, and this committee has been working in multiple correlated topics. I also have been working for COP30 ever since I went to Baku COP. We've been coordinating with the indigenous communities in order for us to bring about our needs to COP30. I'm one of the representatives of the indigenous populations of the Caribbean as well as Latin America. So I have a lot of responsibility on my shoulder. I share that with my family and with my community in order to bring about our messages. And this topic is of paramount importance. Thank you, Ministry of Health and the organizers of this event. As Joaquim mentioned, we are assessing whatever is needed and whatever is new in terms of this topic. On mitigating the problems of climate changes, because the climate changes has been impacting the indigenous populations in a huge way. A reflex of these impacts, as shown in the studies, is that people cannot go to the farms after 10 a.m. because of the sun, which is strong. And of course, they will produce less because they cannot work after 10 a.m. Even the Ministry of Health could not finish a study in terms of the impact of the overall impact of the climate changes. But we've been having multiple symptoms in terms of the impact of climate changes. And when it comes to the girls, the indigenous girls, they've been impacted as well. We have to talk about a lot of parts in Brazil that are being impacted. The menstrual periods are actually they're having the menstrual periods earlier and precociously as well because of the impacts. We need professionals, health professionals that are attentive to this topic, and we have to be attentive on the climate changes problems in the vulnerable communities. It is important for us to highlight that we will have a second COP in the Latin America, which will be in the Amazon region in Belém. And I've been going to the COP30 since 2011. It is not easy to pretty much discuss about our topics in the COP30 because it is it was done, right, in order for the governments to discuss about these topics. We were, ever since we started going to the COP30, COP28 actually, we gained space little by little and continuously because we didn't have any space together with the governments and so on and so forth. What is COP30? Well, it is a space of the United Nations. We need a credential in order to be in the negotiation table, and we need to proceed, gaining space little by little. COP30 will bring, most importantly, first of all, the Bonn conference is one of the most important conferences in terms of these topics of the adaptation, mitigation, financing, gender-related questions and topics, and so on and so forth. We have multiple people, negotiators, following these topics, the negotiations of these topics. And I always say that we need to conversate with our negotiators in order for them to take to the table our demands. And most importantly, everything will be important in the COP30. The social movements outside of COP30 and also the movements within the COP30. And I myself, as a special envoy of COP30, I have to work within the COP30 and outside of COP30 as well. And I have to take all the experiences and discussions that were done outside of COP30 to the inner table, to the table of negotiation of COP30. And therefore, we need to do everything in order to conquer some ground as the indigenous population. So this is important, and it is pertinent in this moment to have a conference like this one. And we've been having multiple conferences just like this one, and this has been impacting the climate changes. And it is important for us to leave this conference saying that there's an urgency on the mitigation of climate change's problems in multiple environments, and we need to be urgent in our activities. We had COVID, right? And then a year passed. So many people perished because of COVID-30 and multiple people of COVID, right? And a lot of people survived, but we might have epidemics that we do not know, pandemics that we do not know the illnesses, right? So how to survive to this? As indigenous populations, as vulnerable communities, we have people who are trained in order for them to handle right, the mitigation of problems because of the next pandemic. So we have to think about the climate. We cannot wait till tomorrow. We have to do everything today. And when I was invited as a special envoy for COP30, I understood that this is a way to take the demands of the indigenous populations to COP30. And it is important for us to have this place, to gain this space of participation. It is important for us to take our clear contributions, our strategic contributions to this space, recognizing that we are the doctors of climate, and we have to be inserted in this discussion. And next week will be in an event. I was invited. I was one of the invited people by IPCC, and I am connected to the adaptation projects and so on and so forth. And I will be taking all of the demands of the indigenous populations to this event. Well, today we have renowned specialists, experts, academics, scholars, right? Taking our demands to the round table. And this is important, but the biggest solution in terms of the COP30 is that the countries need to comply with their agreements, and they need to have public policies that are clear and feasible in order for us not to have the global warmth, right? And climate warmth. the last 3 years had a raise on the temperature of the planet. Not only, and we see that in Rio Grande do Sul, in the Amazon region. And when we do a study, an overall study, we see that we were mostly impacted. We were really impacted by the climate changes, and it is interesting. Today we don't see the women taking the potato from the ground to pretty much feed their kids any longer because there's none. So thank you very much for your participation. I don't know all of you, but I know that all of you has this objective of getting together in order to reach our objectives, and it is important for us to be together, to have clear objectives, and to pretty much advocate and mitigate the problems in the indigenous populations and vulnerable communities. Thank you very much.
Thank you very much, Sinea. I'd like to underline a point that you mentioned about this 62. This 62 meeting is a meeting that occurs before COPs to discuss the decision-making process which will happen amongst countries before the COP takes place. So the COPs were born as a diplomatical process and need to be decided upon consensus. All countries need to agree. And this is very important, but it's not everything that we're speaking about. For example, the fact we have more healthcare professionals taking care and considering climate change, we do not need a consensus of 193 countries to do this. And this is why the Belém Health Action Plan, this is why we have a team with 30 priority items, amongst them the construction of resilient healthcare systems, and the plan we are discussing here is essential part of all this. So this does not need a consensus. COP can be a moment of having commitments with public policies that will actually be executing. It can be the moment that an organization is committing itself to funding this initiative. It might be the moment that a university states it has the conditions of offering capacity building. And so working with these many possibilities is a request for people to elaborate a mutirão, like an organizing unit. So come as you are with what you have, with the tools you have. So there's a complementarity, and we can all contribute. So this is the way we can contribute the best way possible. And now I will pass the floor to Andre. And one of the provocations that Joaquin mentioned is that sometimes people are not necessarily working within the Ministry of Health. Like Joaquin mentioned the fact that he was working with forest. How many hours do I have? Sorry, good morning to all of you. Alice, thank you. It is a it's a great pleasure to be here. Ethel, Joaquin, Sinea. I will try to wrap up on the reflections and speak about an aspect that is directly, it doesn't seem to be connected with health, but it actually is. It's the forest. And it's quite surprising. I mean, we know our COP30 will occur in the heart of the Amazon. So I am a special envoy from civil society. I am also guiding the environmental study of the Amazon, IPAM, and we have been working for 30 years trying to understand the interaction between the forest and human activities. And so this experience and this of civil society with the environmental theme is something which is ongoing. So IPAM, as an institution, has participated in 28 COPs, and so this will be the 29th COP we are participating in. And so what I like to underline, two dimensions that the forest brings to this debate that we are promoting within this very important conference on health and climate. First dimension is the role of forests in the harmonization of human activities, and that aims, which also promotes food security. The second dimension is the risk that the forest is going through, and as it goes through this risk, it also risks our livelihoods. So first, let's speak about food security. Let's put this into perspective and let's see a few figures. First of all, we need to understand that 50% of world food is produced in tropical regions of the planet. And we can only do this, and I'm speaking about Brazil, Congo, Indonesia, Thailand, Colombia. We can only do this because we have a forest. Forest is fundamental. Not only does it make water available, but it also distributes water for agriculture. And Brazil offers food for 10% of our planet. So if we take a plane to São Paulo, in São Paulo, and we fly all over the planet, the only place where there isn't a desert is in the southeast of Brazil. So 90% of Brazilian agriculture is not irrigated. It depends on rainfall. And so when we take a look at Amazon, if we jeopardize the forest in the Amazon, we are actually jeopardizing the Brazilian GDP, and there's no way we can ensure food security for the planet without the integrity of the Amazon. We cannot reach the goals of the Paris Agreement without taking care of the Amazon. So the Amazon forest stocks 10 years of carbon dioxide, and so if we do not look at this, things will not happen, things will not function without the forest. And so I bring this element of food security because recently I went to China. It's been 2 weeks I've been back from China, and we spoke, amongst other issues, about the important role of Brazil as an important supplier of food to China. And we are very proud of the electric cars, Chinese cars we see here in Brazil. And speaking with different authorities, different scientists in China, the respect that they have for Brazil, for the fact that Brazil helped China to leverage the livelihoods of 800 million people under the line of poverty, and that Brazil helped them to take these people out of this situation. We only managed to do this because of the fact that we have an integrated and fully functioning Amazon forest. You know, if we didn't have this, we could never have helped China. And this is the first thing I wanted to underline. It's the fact that we actually invaded the Amazon forest, and I'd like to apologize to Joaquim. I'd like to apologize to Sinea. Not only are we violating the rights of people of the forest, but also we are violating their rights. And so the Amazon has something somewhat like 18 to 20% which has gone through deforestation. This forest has disappeared, but however 30% was degraded. So we see a forest, but it has already gone through wood and timber extraction, has gone through forest fires, so it's degraded. And so I need to mention this now because we are discussing in Brazil the possibility of extracting petrol in the Amazon. And so Minister Padilha, who should be participating in this round of discussion with the Minister of Environment, Marina Silva, discussing about oil. And this means that we will be witnessing increasing global warming if we continue deforestation and degradation. And because our forest is responsible for food safety, for energy, for water, so it's fundamental that we look at the forest as a supplier of services, of food, of shelter, water, and also as a safeguard for our future health. So I'd like to go back to the Chinese example. They are very proud of managing to withdraw 800 million people of the Chinese population who were under the poverty line. And so the growth of the supply of food until 2050, 42% of these food supplies will come from Brazil. So we have a huge responsibility with food safety. We need to supply food for the world, and this is a brutal responsibility. We need to understand that if we do not take care of our forests, there we will have loss of biodiversity, diminishment of rainfall, problem with food security. So we feed 10% of the world population. So if Brazil is jeopardized with all these actions that end up degrading and deforesting, so we use soy. Our Brazilian soy feeds animals in China. Everything will experience an increase in prices if we are not players in the world scenario of food safety. So we are going through the risk of diminishing health of the population, and we need to discuss this. So we need to really invest now and not wait that the problem become even graver. We need to invest in forest conservation now. We need to think seriously about the fact that the Amazon nowadays supplies not only all those services, is also a path of routes of Brazilian exports. It's a route of Brazilian exports. So it's important to congratulate this role of Brazil in the world, and this is excellent. However, to open a highway in the heart of the Amazon to develop a major project of hydroelectric dam, this encompasses an ensemble of risks for the Amazon forest, for the Amazon population, and the forest ends up becoming torn apart. So if we are living in a country which will be leading the world, because the world does need Brazilian leadership, I believe. And so due to the generosity of the Brazilian government allowing us to voice our opinions. So when we have a voice, we have the responsibility of fostering these challenging discussions. And so we need to discuss these aggressions that fossil fuels provoke on territories. And this needs to be further discussed. And the agenda, I'd like to mention, since the time is nearly over, the agenda of conservation of forests did not exist within the Kyoto Protocol, which ended in 2015. Until 2015, the forest was not part of the equation. From the Paris Agreement on, it started becoming a priority. Why? Because civil society proposed a strategy, which is REDD+, which is paying for the forest conservation, and Brazil is a leader in this process. So we need to take not only the issue of fossil fuels and its implications, we need to take the discussion about tropical forests, food security, and the health of the planet in COP30. Thank you. Well, we have many aspects, and I'm just taking a look at the organizational team because we're running late. We know that everybody will probably want to comment and ask questions. So before I ask my question, I'd like to see if Ethel would like to react to what was said. First of all, I'd like to say that the presidency of COP gathered a marvelous team. It's the first time we met face to face, and I was talking to Joaquim that we were there together. We had the opportunity of meeting each other and listening to different viewpoints, and that was lovely. and enriching. And the idea of the president and Ambassador Andre is that we manage to be this resonance box. And this was very, very clear here. I'd like to say that the issue of the Amazon is fundamental for health. We also had the opportunity of developing a diagnostic, and I believe it will be launched, a specific plan will be launched, because the Amazon has existential and surveillance gaps, and indigenous populations in riverside communities have to travel for days to have access to healthcare. So we need to look at solutions that do not depend on agreements, but they depend on political will, and it's actually happening at this very moment. And so Livia Alenia from Belém, from the Evandro Chagas Institute, who participated in the construction of this healthcare plan, we need to develop a state plan in order for us to implement these projects. And so Andre mentions that at this very moment we have something that we really need to do as a special employee, which is raise the awareness of our parliamentarians. We have a government which has one viewpoint and one opinion, and the parliament that has an opposing viewpoint. And so when we have an ensemble of laws that will have a deep impact on the environment, a negative impact on the environment, and I would like to, I hope we manage to veto the bill of devastation, because it is fundamental for health.
Muito mais do que a gente pensar com
I think that more than thinking of the conference, we need to think about our country. Any result that we will have during a global conference, it will be thanks to a Brazilian initiative, because this contradiction that our colleague mentioned, internally it is evident that the conference itself suffers with the sabotage of the process. So the sabotage is happening in this very moment in our country by many sectors. So why are we debating? And so we need to have this deeper understanding of these contradictions to make sure what do we need to do in order to face a bigger agenda. This is fundamental. And for me, as member of the community, as Simea mentioned, being part of the Amazon that needs a fuller, more concrete response, which is more feasible, and leaving this long-term perspective, we do not have time for this. The moment is now. For us, if we wait for longer, I don't know what will remain from the Amazon. So I remember my dad used to say that greed is something that goes against people's intelligence, because you become blind to the consequences, and people end up killing one another because of greed. And here in Brazil, I think we need to do our homework so that we can leave COP30 with feasible agreements, and we need to do a lot for ourselves here in Brazil. Thank you. We have to run because time is flying. I'd like to say that with the words Andre just mentioned, that this bill, which we are calling the devastation bill, will devastate not only this highway that people are constructing, but everything that has to do with deforestation can happen from one moment to the next if this bill is approved. because things will become too permissive. Concerning fossil fuels, we cannot discuss about health and livelihoods without discussing issues concerning fossil fuels. We know that in the last 2 COPs occurred in countries driven by oil production. And so the other issue that Andrea mentioned, we have 2 questions, global climate change and local climate change. And when I take a look at the local climate change, I look at the monocultures in our country. When we see, when the workers are called to foster monoculture, this monoculture ends up jeopardizing the rivers, the water hydric sources of the neighboring borders. And so we need to realize this issue of the impact of climate change, of floods and droughts, and people keep on having this type of careless action, thinking nothing will happen. Thank you very much.
Thank you, Simeon. I'd like to pass the floor to the mic to you, Andre. And I'd like to, first of all, open the Q&A session to the public. I'm sorry, actually, this question came from the public, and I'd like to know how we can come up with a solution for the forest deforestation to get with the taking into consideration the climate changes and the health as well. And this is a great question. So let me make a comment on this, first of all. We always talk about the Amazon region, right? So it is huge with a lot of people, right? No, 80% of the Amazon region is non-urban. And when we go to school, when we go to the city, we forget about the forest. We forget about pretty much everything that is related to the forest. And forest will offer us the benefits of water, of air, and so on and so forth. So this distancing from, and this, let's put it this way, division of the farm and the city, or the forest and the city, is problematic, because the production of the food, for example, comes from outside of the cities. And we've been working with the students of high school here in Brazil with this topic. And the question that we posed was, where does the milk come from? And then the students would tell us, look, the milk will come from the supermarket, will come from the truck, will come from multiple places, but not from the cow. So this is a huge distancing of the population that live on the farm and the population that live in the cities. And I think that the COP30 is a space, it's an open space for us to bring together, right, the farmers, the city handlers, and so on and so forth. And also, we have the professor Felipe, right, who has this agenda of reconnecting the cities and the farm, the cities and the forest. And you've got to agree with me. The population of Belém, of Bela Vista, of Rio Branco, they have the reference of the environment because they live there. They live 20 kilometers from the farm, 20 kilometers from the farm, from the forest, right? However, in the big municipalities in Sao Paulo or in other cities, they lose this connection. They lost this connection, right? And this is really important to be noticed and to be notified as well. Joaquin, Emily is asking us to tell a little bit more about how the contribution of the indigenous populations and traditional communities can bring about novelties in the COP30. Thank you for your question. It has to do with what Andrea mentioned, the territories. these 80% of the Amazon region that Andrea mentioned about is of paramount importance. The public governance when it comes to school, to the academia, the schools, and so on and so forth. And even the forest code of Brazil, the legislation, and the sources of knowledge, the academia, they work only with 20% of this Amazon region. And the code of the legislation forest, right? They will work with with only 20% of the forest, and the other 80% is disregarded sometimes. The state, as academia, as science, they have difficulty to work working with these 80%, and this 80% offers, right, all the system that at the end of the day comes to our table in form of products, in form of food. It comes from the nature, right? And it is connected or intertwined with the diversity, biodiversity, the agribusiness. When we talk with them, they tend to think about the biodiversity. They have already put in their portfolio the biodiversity as a great business for them to use. But that biodiversity is a strong component in terms of production of food and in terms of the services that that it is provided through the biodiversity. When it comes to the quality of the food and the safety or biosecurity, we do not have a connection of these topics to this 80% of the forest. When we talk with people at the university or even people or students at their school, it is hard to see that there are children out there thinking that an egg comes from the tree. So they're completely disconnected to the reality of the farms of the forests. So there is a bubble in the cities that is pretty much departing or fathering the farm and the cities, the pretty much forests and the cities. So we are losing this connectivity. And this is important to be highlighted. Thank you. And it is enchanting to hear all of you. And it is hard to moderate this because we have multiple questions here, right? Eric is asking us to tell a little bit more about the connection of the environmental action and the rights of the health professionals. Eric, this is a huge question. Everything is intertwined. We are now in August. We will have our international conference of health workers. We have multiple events, national, municipal, and as well as state events in order to discuss about this topic. This topic of health of the worker is of paramount importance, and this is of paramount importance for this event. And we've been seeing Sinazi and also other panelists talking about the health of the worker. And some workers cannot work in their harvest because of the impact of climate changes. And we've been seeing in multiple other countries the impact in construction, right? Civil construction, because of the high temperatures. They need to close down the field where they are constructing a building because of the heat. This is impacting our country in the agribusiness, right, sector, infrastructure sector as well. So we will have to rethink about this work conditions. The conditions are really lacking off or really lacking behind, and we have a time that goes really fast, that is always needing more of us. We have the regions in the Amazon region in Manaus where an entire region was burned to the ground, and people, the workers, they do not have their work any longer because of this condition. So worker, for example, that is working in the transportation of food, they cannot work any longer in certain regions because of the heat. So a lot of workers will be and are being impacted by the climate changes, and we have to think about the work that we need to do in order to improve the quality of the health of these workers. And we have to discuss this on COP30 and with the Ministry of Health. Thank you. Thank you very much. We will need to wrap up here. Unfortunately, we will have to wrap up. But one question for Sinaya, the last one to wrap up, and this is a Hilton question, a question of Hilton. And in the current status situation, where the richest country will not be in the COP30, and the richest country is positioning itself against our objectives, how will these agenda of the climate reach its goals? Well, this is important. It is important for us to have an engagement in the COP30, and it is important for us to have the crowdsourcing as well in the entire season of COP30. Without financing, without the funds, we won't be able to reach our objectives, and we won't be able to reach our objectives without the crowdsourcing, right? So we do not have the richest country in the world, but we have the other countries, and we believe that we will reach our objectives. We, indigenous population, peoples, we are really strong. We need to continue our work. It is not because the richest country won't be there that we will lose ground, that we won't reach our goals. A lot of other people, a lot of other countries are with us in order to reach the response, in order to reach the funds, in order to reach the mitigation of problems in the population, in the indigenous populations, communities, and also elsewhere. It is important to have the fund. It is important to have the fund for health, education, and for multiple other sectors. Otherwise, we won't implement this agenda of the climate changes through public policies. Another part that is of paramount importance is to have partners, philanthropic partners, institutional partners, right? So these partners will implement actions in the indigenous and traditional communities as well as elsewhere. It is important to have public policies as well being implemented in Brazil and in other parts of the world. Thank you. Thank you. Thank you, participants who made the questions. This experience was really enriching, and the process of COP30 is all about discussion, is about translating our voices into this right event. And this process is a process of listening to the voices and experimenting as well, trying new solutions. We are coming up and looking for new solutions, bringing about different voices. And for us in the presidency of COP30, it is important to listen to you because it brings your voices to the center, to the middle ground of these discussions. We've been talking about mitigation a lot. We won't be disregarding the mitigation. We didn't give up on the 1.5 degrees Celsius reduction of the temperature, right? And this is put on the agenda of the action plan. And we have to think about a society without the dependence on fossil fuel. We have to have the fossil fuel not as a determinant of our lives, not as something that we will lean on or depend on. And it is hard to imagine our lives without the fossil fuel, but we have to rethink about it. We have to think about our lives without the fossil fuel. We have to make the transition. It is not about if we will need to make this transition or not, but it is about how we will make this transition, because we will necessarily need to adapt ourselves to the new system, to a system without the fossil fuel, and we need to look at the local communities and bring about new solutions for their problems. So thank you very much for your attention. Thank you, Ministry of Health, WHO, PAHO, for organizing this event and for bringing all of us together in to help the COP30 and to improve our public policies and the situation worldwide. Thank you. I'd like to thank you, Alice, and all the special envoys. I'd like to invite you to pose to a picture. And the lunch is being served at the very same restaurant, right? Reminding you that we should be punctual, right? We will give you 15 minutes on top of the time that we traditionally have. So at 4:15, please. At 2:15, please. Be here in order for you to have the other sessions, and don't forget to just leave the headsets outside with the technicians. Thank you.
Senhoras e senhores, participantes da quinta.
We will move on with our conference on climate and health. We invite everyone to attend the auditorium, to take your seats. We'll begin the closing ceremony.
Ladies and gentlemen, we welcome everyone and invite you to join us inside the auditorium. Senhoras e senhores,
Ladies and gentlemen, good afternoon, everyone. We've reached the end of our 4th annual conference on climate and health with the feeling of an accomplished mission. It has been 3 days of intense discussion where each participant has contributed to the report on the health plan of Belém, strengthening the 3 main lines: vigilance and surveillance in health, political strategic based on evidence and capacitation, innovation and production. We thank the partnership and the support of Spain, the United Kingdom, the Gates Foundation, the Rockefeller Foundation, and the Wellcome Trust. We also thank the presence of the following partners: Coalition to the Continuity of COP Residences of Baku in Climate and Health, the World Organization of Health, WHO, World Meteorological Organization, ONM, United Nations Program for Climate, PNUD, OPAS, Osvaldo Cruz Foundation, Fiocruz, United Nations for Environment, PNUMA, Convention over Climate Change, UNFCCC. Our special thanks to international organizations and multilateral development banks, academic researches in climate, in environment and health, policymakers and the Ministry of Health, and national authorities in health, civil society representatives, base movements, philanthropic organizations, high-level representatives of traditional communities, and of course, each and every one of you. To compose this closing table, we'll invite to the stage Secretary of Vigilance of the Ministry of Health, Mariangela Simão. Representative of OPAS in Brazil, Christian Morales. Representative of ATACH, Helena Villalobos Prats. Partnership Director in External Subjects from Tamarav, Testa Lakio. General Coordinator of Adaptation from the National Secretary of Climate Change, Ministry of Environment and Climate Change, Itamara Mello. Boss of Global Health Division, Foreign Ministry of Brazil, Igor Barbosa. Before the lectures, we watch a brief video. Political Leaders, Global Alliance for Climate and Health, from Jess Bigley. Obrigado.
For organizing this fantastic meeting. I'd love to share with you today a few messages that came up.
Apenas algumas adaptações.
Thanks to the government of Brazil and to WHO and PAHO for organizing this fantastic meeting. I'd love to share with you today a few messages that came out of a retreat earlier this month, together with 20 other organizations from across the health and climate movement. We've seen a real elevation in the way that health is stood in the UNFCCC space, COP26 health commitments, the first ever health day at COP28 and a declaration. And now we've got the Belém Health Action Plan. All of this has built momentum on health. And now we need to translate this momentum into the negotiations. Climate change, as we all know, is the biggest threat to human health. So we have to play our part in making climate decision-making as ambitious as it possibly can be. This is decided in the UNFCCC negotiations on topics like adaptation, mitigation, loss and damage, and finance. Health is not just a side note, it has to be mainstreamed across all of the different areas of UNFCCC decision-making. Adaptation is the first area of the negotiations where we've seen a deep and dedicated focus on health. Adaptation is essential. Every part of the world is already feeling health and the other impacts of climate change, most heavily in communities that have contributed least to climate change. Indicators are being developed, the Global Goal on Adaptation. These are not just indicators for the healthcare sector, but also in health determining sectors like water and agriculture. It also matters that we as the health community are laser focused on getting the right means of implementation indicators. We can have the best health indicators in the world, but unless we've got finance and technology transfer and capacity building to build the action that's needed, they'll be entirely redundant. Even at current levels of warming, health systems are challenged. We don't know what this looks like at 2 degrees Celsius. How do we begin to plan for 3? For this reason, it's vital that we get a handle on emissions reductions. Fossil fuels are the leading driver of climate change and its health impacts, and also cause additional health harms from the moment of extraction through to combustion due to air, water, and soil pollution. At COP28, governments agreed to make a just, orderly and equitable transition away from fossil fuels. The global north has to be first in phasing out existing fossil fuel infrastructure. Fossil fuel expansion has been made clear by the IEA to be out of the question, and by extension, fossil fuel exploration. In addition, we can't rely on fantasy technologies like carbon capture and storage and geoengineering. The energy sector is not the only sector in which we need to make transitions, and when we're making these transitions, we need to not only be thinking about reducing emissions, but also building resilience and adaptation, and this is covered under the Just Transition Work Programme. Just transitions are about the health and livelihoods of workers as they shift to new forms of employment, and also about ensuring access to food and energy and water, and avoiding creating new health hazards or maladapting to climate change. In terms of next steps in the UNFCCC process to facilitate these just transitions, we need technical assistance and also coordination, accompanied by principles safeguarding health. Within loss and damage, making sure that health expertise is reflected in the Santiago Network for Loss and Damage can ensure that the health needs of communities are met following climate disasters. There are two main issues: blocking ambitious climate decision-making and implementation. The COP29 finance outcome was gravely inadequate, both in terms of quantity and quality. Developing countries had made it clear that they required 1.3 trillion of climate finance to be able to undertake the climate action so urgently needed. However, developed countries only committed to mobilizing 300 billion. There was also no commitment to non-debt-inducing forms of climate finance. Debt reinforces cycles of poverty and disease. The poorest countries in the world are already spending more on debt service than they are on healthcare, education, and infrastructure combined. In 2022, implicit and explicit fossil fuel subsidies totaled $7 trillion, far in excess of the 1.3 trillion. Removing explicit fossil fuel subsidies and pricing fossil fuels according to their externalities could avert 1.6 million air pollution-related deaths annually. We've seen incremental progress in the UNFCCC in addressing the conflict of interest around participation by polluting industry. At COP26, there were 500 fossil fuel lobbyists. At COP27, 600. And at COP28, 2,400. The UNFCCC process needs to take the lead from WHO processes, with one example being the Framework Convention on Tobacco Control, which explicitly excludes the tobacco industry from policymaking. In closing, I want to link back to WHO's description of the Paris Agreement as a health agreement. It's our responsibility as the health community to ensure the ambitious delivery of every aspect of the Paris Agreement, from mitigation to adaptation to loss and damage and finance.
To give his word, we invite the boss of Health Division of the World on the Foreign Minister of Brazil, Igor Barbosa. Well, good afternoon, everyone. Firstly, it is a great honor to share this closing session with Dr. Mariangela, with Christian, with other participants. I personally have a great admiration by Dr. Mariangela from the time we were in Geneva, her as a co-director to Access to Medicine, and I've participated in a few meetings that really struck me. Overall, sharing with you the presentation reunion of our report on medication pricing against cancer, because the conclusion of ONMS was simply there are no rules. Companies charge what they want to charge according to other countries and to what people can afford. To the powerful director of FPMA, we have different data. Then give me the data and I'll see that to them. But to this day, it never got to us. These data never got to Dr. Mariangela. And I always have the honor of sharing this study that even though there have been some years, it is very new. It's important to participate on this global conference on health and climate change. We at ATACH, as you know, we are developing great work overall on the preparation to COP30 on the Belém COP, which will occur this year in Brazil. The Brazilian compromise with the theme over climate change and on interface health and climate change is a compromise that has been highlighted even before the actual government, when President Lula was at COP27, and said that Brazil would host the Belém COP30. The health theme is a theme that is as a priority on the Belém COP, and without doubt, we'll have a fundamental report in our action, which is the adaptation plan of Belém. I expect that this conference has been useful to advance the discussion on the elaboration and the confection of this plan. We've been trying to collaborate as well. To the success of this plan, we will be having consults that we've had in Geneva, and we'll be in Belém also participating through the events so that the plan may bring clear objectives and how we will be dealing with adaptation on the theme of health and climate change. To also highlight that Brazil is not limiting its action in the interface of health and climate change on COP. We've been dealing with this on the SUS, on HWO. We have been talking about climate issues on health. On the beginning of this month, we had a high-level dialogue about climate determinants on health. This year, the presidents of external policy and global health will be also talking about the climate determinants. And so Brazil is compromised in a very cross-cutting way. I thank for the floor, and I hope to contribute to the debate. Thank you. With the word, the General Coordinator of Adaptation from the National Secretariat of Climate Change, Ministry of Environment and Climate Change, Inamara Mello. Thank you. Good afternoon, everyone. In the name of the Environment Ministry, I'd like to salute the participants at this conference, particularly the health institutions of Brazil that have been contributing a lot to the strengthening of the adaptation agenda on our country. What we congratulate in this conference, we wish that we might highlight how this moment is great, is special, how we live in opportunity moment to the adaptation agenda for climate change, not only in Brazil, but also on the international context. Once Brazil, when he puts himself as a protagonist on this agenda, has tried to give visibility to the adaptation theme in many international forums. It has done this on G20, on BRICS, now with COP30, and we've been doing so, understanding that such a vulnerable country as Brazil to climate change with this profile must bet at an adaptation agenda that considers the people and the most vulnerable groups first. We wish to tell you that we understand that we are conscious about the necessity of doing our homework. We understand that Brazil is an important showcase to the climate agenda, and we don't have few challenges, but we are trying to lead by example. We are preparing to a pre-COP at Brazil, the deliver of our national plan of adaptation, our climate plan adaptation that involves the 25 ministries of the federal government, 26 themes and sectorial facilities. This represents 800 actions to reduce climate effects on the country, and we know the success of this work is due to, firstly, a political decision of Lula's and also of the Minister Marina to make the sustainable development agenda a pulsing and necessary agenda that must come to the center of the political agenda, but we know that this has also been built with the participation of a lot of people. It has been many institutions, many organizations from the government itself, but also from the civil society that has dreamed alongside us to build a robust agenda integrating the cities and taking the adaptation agenda to all its actors and thinking on building a policy that looks like Brazil, meaning so that we've been aiming to bring the plan not as a federal plan, but as a plan to the ministries of the federal government on a path that took basically 2 years on an elaboration work. We saw the necessity of integrating our national plan to the local realities, since Brazil has continental dimensions, great geographic diversity, a great coastal area. We have 6 biomes who are unique in distinct levels of development alongside our territory, and this demands incorporation of the climate sense and of adaptation through technical themes, capacitation, strengthening to a planned development of public policies. We can't draw a single policy that doesn't consider the climate. And for that we must do this great effort to bring to the government programs and also to the state programs, and from the cities, private sector and civil society, in effective integration of the climate agenda. So we've been working to build this integration, and with this, it was born the initiative Adapta Cidades, an initiative that is financed primarily by the GCF, a green fund for the climate, but that has many other actors and many other institutions. We started with a proposal of reaching 260 municipalities. We have now 580 municipalities indicated, where we work to support the elaboration of local plans for adaptation, and from there, this partnership that also happened on the national level with the Ministry of Health now extends to a local level. So we've been working to amplify this federative governance, guaranteeing the representation of the civil society, a big representation throughout the federation team, so that we may identify the impacts, the management of climate risks, identify vulnerabilities, threats, to prioritize measures, and to give access to climate funding. This must reach the cities. And in this process, we believe that it's a robust agenda, a structured one, that looks at the global objectives of adaptation in the light of the national circumstances, and like this we are able to build a strategy very well structured, multi-sectorial, multi-level, with a lot of participation that recognizes the climate crisis demands articulations throughout different actors, that has as guide the promotion of climate justice, that takes into consideration questions of race, of gender, of vulnerable populations, that bring in perspectives of reductions of all factors that add to social environmental vulnerability. And we have no doubt that this initiative in little time will consolidate itself and may become a model for other countries. This is an example that we wish to take to COP30, working so that this theme occupy a highlighted space, so that we move from the debate to action, to funding, to investment and integration of many policies, guaranteeing the conclusion of the worldwide goal on adaptation and development of a pathway to reduce climate impacts. So I end my speech giving an invitation to other countries here in this conference, so that you may bet in a model of governance that is multi-level to the implementation of the national plans of adaptations. We understand that this is the way to make the agenda of adaptation to reach the territories, to land on them. We wish to build on a cross-cutting way, on a multi-level, multi-sectorial, and with a participation way, an agenda that is robust with the participation of all. And we have the clarity that the health issue must occupy a center position in this debate. Thank you very much, and it has been a great honor to be able to participate here with you of this closing session. Thank you very much. Thank you very much, Amara. I now give the floor to the Director of Partnership and External Business, Best of luck you.
I'm going to put away my translation device. I don't speak Portuguese. I'm hoping that by the time I leave here, I will pick up a few words. So I'll put this down for a second. Thank you so much. I've been told that I have to observe all protocols, and so allow me to do that when we start. So I'd like to acknowledge the organizers of this and the sponsors, the government of Brazil, the WHO, the Pan American Health Organization, PAHO, the Alliance for Transformative Action on Climate and Health, the Rockefeller Foundation, the Wellcome Trust, and the Gates Foundation. So thank you very much for convening us. This is the first time for me in the beautiful city of Belém, of which I have seen only this convention center. So I hope that after this evening we'll see a little bit more of that. It's a pleasure for me really to be here on behalf of AmRef Health Africa, which is the largest health development organization on the continent of Africa. And we have been working for the last several years, I would say since COP27, on the issue of climate and health. And so I think that this conference could not have come at a better time than now, particularly when global multilateralism is at risk due to shifting geopolitics. So it's been said in the past few days, but allow me to repeat this because it's so very important to every country on our continent. Extreme weather events might be just news to some people around the world, but they are actually a lived reality for those of us in Africa. Africa has the least emissions, and yet it is hit the hardest by extreme weather and climate change, impacting every single aspect of socioeconomic development, exacerbating hunger, insecurity, and displacement, leading to general worsening of health conditions and service delivery. And most recent examples include the devastating impacts of cyclones in Ida and Freddy, which left a record-breaking trail of death and economic damage in southern Africa, consecutive droughts and flooding in the Horn of Africa, Ethiopia, Kenya, and Somalia, causing widespread food insecurities and malnutrition, heat waves in North Africa and the Sahel region, resulting in heat-related illness and fatalities, flooding across various regions, causing significant damage to infrastructure, displacement of populations, and loss of life, with the most recent examples in Niger, Nigeria, and Burkina Faso. I think it's important to just pause here to understand that the impact that we see on our continent is not only significant, but there are also not sufficient resources to really combat the impact of climate change on our continent. And because AmRef operates in more than 35 countries across the continent, we have been extremely engaged at the intersection of climate and health across the region. We work extremely closely with WHO Afro, with Africa CDC, and our all-weather friends, we call them all-weather friends, at Wellcome Trust, the Rockefeller Foundation, Foundation S. And we've been leading technical, policy, and multi-sectoral interventions to support African countries. Over the years, we've done quite a number of things, a list of things. We've launched a Climate and Health Regional Initiative for Africa at the 76th World Health Summit, or Assembly, sorry. And we came out with the first ever Africa Common Position on climate and health. We convened the first ever high-level ministerial at the inaugural Africa Climate Summit on Africa's climate position. We played a key leadership role in COP28, Health Day, and we support African countries to sign up. We advocated for the first ever inclusion of health in the African Ministerial Conference on the Environment, AMCEN. We were nominated to lead Africa's climate and health input into Intergovernmental Panel on Climate Change, IPCC. We launched the Pan-African Partnership on Climate and Health, PPCH, at COP29. So we've been very much involved in this space, and so we're happy to be here as well. I tell you all of this not to boast about the work that we have done, but rather really to tell you that what we're seeing with the Belém Action Plan launch is very exciting for us, and it is very much aligned to the work that we have been doing and also to the health framework that we developed over a year ago. So we see alignment across 7 key areas. The first is around shared vision and equity and justice. The Belém Action Plan puts climate justice and health equity at the center. This is not just in principle, it's a call to action. At AMREF, we operationalize this through community-led programs that prioritize the most vulnerable: women, children, pastoralists, and the informal settlements. Our One Health for Human, Environment, Animals, and Livelihood initiative is a prime example which builds on the resilience in drought-prone regions of Kenya and Ethiopia. Second, on governance and leadership, the plan calls for inclusive governance. AMREF is already leading this charge, co-developing the Pan-African Common Position on Climate and Health, and shaping regional declarations like AMCEN 2024. We're not just participating in global forums, we're actually helping to set the agenda. Third is around surveillance and early warning systems. The Belém Plan prioritizes early warning systems. AMREF has implemented geospatial health and weather monitoring tools that are already helping communities anticipate and respond to climate shocks. This is about saving lives for us through data-driven preparedness. The fourth area is capacity building and research. Both frameworks emphasize training and evidence. AMREF is scaling this through our own climate and health technical framework and a new Center for Policy Research at our AMREF International University. We're also part of the JLN, Climate Smart Health Systems Collaborative, sharing African innovations globally. The fifth area of alignment, innovation and cross-sector collaboration. The Belém Plan calls for innovation. AMREF is piloting integrated service delivery, combining WASH, nutrition, and green energy. And this is what climate smart health system look like on the ground. Sixth area of alignment is around global advocacy and COP30. In fact, AMREF is not just aligned with the Belém Plan, we're actually helping implement it. From co-leading the global conference on climate and health to drafting the health component of COP30 cover decision, we're shaping global commitments. We're also working to translate these into national action plans for Africa. So even as we stand with the Belém Plan, I note a few things that we need to better articulate. So over the last 3 days, quite a bit of conversation, and yes, I'm hearing it with headphones and translation service, so there may be areas that I'm missing out. But here are some things that I've picked up that I think that as we leave this conference today, we need to think about and we need to really work on. The first is this commitment, like any other commitments, requires financing. So although we had our partners like World Bank, etc., speak about financing, we need to make sure that the Belém Plan is financed. So that's number one. The second area is that it requires concrete implementation plan and time-bound actions. So I didn't hear that in this discussion over the last 3 days, and I'm hoping that between now and COP30, we see that coming through. We need strategic partnerships. Who are the partners that can help carry this body of work forward? I will tell you, we have African representation in this room, and we may not have financing, but we have experience. So let's see if we can find some partnerships with colleagues in Africa and in Asia as well. It also requires us, and this may be a little sensitive for some of us, but it requires us from really moving out of this technical echo chamber that we're in. Everybody in this room is comfortable where they are. We all know one another, and we are all saying the right things to each other. But I think what we need to do is we need to bring people who are actually going to carry this message forward to COP30, and that means our negotiators. So in our case, it would be the Africa group of negotiators. They need to be here because they are the mouthpiece that are going to carry this forward to COP30. And then finally, I think I'd like to express the following call to action for all of us in this room, but in particular, I'll call out a few of our colleagues. First and foremost, to our policymakers, and we have some in this room, you have a critical role to play, and we need your support to integrate health into national climate strategies, to mobilize climate financing for health systems, to ensure African leadership is front and center at COP30. Together, I think we can deliver on the promise of Belém Action Plan for a healthier and more resilient continent in Africa and also here in Brazil. To our partners, whether you're from private sector, from foundations, or from development banks, there is such an incredible opportunity to unlock shared value with partners in this room. And I'd like to highlight a few of these from our perspective and our experience at AMREF. First is the private sector. I saw from day one there are private sector members in this room. The Belém Action Plan calls for innovation, resilience, and inclusive growth, principles that align with private sector priorities. Find trusted partners and invest in climate-smart health systems that deliver both social impact and business value. Co-invest in innovation hubs, workforce development, and climate health data platform that align with your sustainable goals. For foundations, and there are a few of them, and some of them are friends of ours as well, the Belém Action Plan is a blueprint for systemic change. And so this means that finding funding partners that are uniquely positioned to deliver on this through community-led, evidence-based programs that center on equity. We've seen how critical our work has been from grassroots resilience building to high-level policy influence. So ensuring that investments translate into both local impact and global advocacy is going to be critical. And there's really an opportunity to partner with those working in fragile settings to expand research to policy pipeline. I can tell you that we're scaling research through our new Center for Policy and Research on Climate Health and shaping global frameworks like the COP30 agenda. And this has amplified African leadership in climate health diplomacy. I think we can do that here in this room in Belém as well. For development banks, the Belém Action Plan calls for robust climate resilient health systems. Partner with those of us who are already delivering on this through multi-country programs that integrate climate adaptation and infrastructure. Keep prioritizing investment-ready models that align with your climate adaptation and SDG portfolios. Support the work we do with countries by providing countries with co-financing of Green Climate Fund and other multilateral mechanisms to unlock blended finance for health. But I think most importantly, what I've come out of and what I will leave with from Belém is really the people, the community, the indigenous voices that we heard from day one. And I will say that most important for me as a representative of a community-based organization that is focused on uplifting and improving the lives of grassroots communities across Africa, those of you who have shared with us the passion and exemplary commitment you have for the preservation of our world and the lives of indigenous people, the fight is not over. Our voices matter, and as one speaker said the other day, we are not vulnerable. We are just put in vulnerable situations. So I say, let's continue to keep our voices raised, and I'll see you at Belém. Thank you.
Thank you.
With the word, Representative ATACH, Helena Villalobos Prats.
I have two hats today. I am representing the WHO and I am representing the Alliance for Transformative Action on Climate and Health. As always, I think the most important for me is to start thanking Brazil for the amazing work that they've done, for their leadership in bringing this agenda so visibly in the run-up to COP. Thank them also for making us live this historic moment. Again, it's the first ever official pre-COP event discussing solely on climate change and health. And as Alan Dargun said also, it's the first ever moment where people are invited to provide inputs to strengthen the action plan that they are putting together. I was asked to reflect on the meeting and to summarize it, but I would like to hear from you. So if we can have 3 people, 5 people, just basically saying 1, 2, 3 words, 1 phrase maximum, and I will cut, basically telling us what is the most important thing that you live, what is the most important moment that you think, or the most important topic that you would like to make sure is included in this Belém Health Action Plan, please do so. So maybe I will invite just one person, Shoko Misaka-san, because it's the first time that he participates in one of these meetings. So maybe I will start with you, and then I want to hear from everybody. You want to go? I think there is going to be he's there. And then if you can start raising your hands, please. We really want to hear from you. He's there.
Raise your hand, please.
If you don't raise your hand, I will call on people, and it's probably worse.
Thank you so much. So there are one word, so it's a high hopes for the future that I feel during this global conference. Don't you feel so? Okay.
Thank you. Thank you very much. Hope, that's good. 2 hands there.
De Perú, del Ministerio de Salud del Perú, metas para un plan y también
including goals for a plan and also the period. What is the deadline we have to fulfill this? Thank you.
Vision that climate resilient health systems need to both adapt to the climate crisis and be low carbon.
Thank you very much. One more hand.
Hi, 2 things. I think co-creation doesn't appear anywhere in the document when talking about communities. I think that's a really important insertion. And the second is climate-sensitive diseases is too narrow for when we think about health and well-being. It's bigger than just disease. Thanks.
Thank you very much. Okay, one last hand. Last.
Thank you very much for the opportunity, Dr. Zakaria Mohammed from Nigeria. I think I want to add that we may need to engage the policymakers more. I'm happy that the honorable ministers were here from Fiji and Senegal, but we really need to engage more of the policymakers at the level of, at least from the level of the ministers. And we expect to have the buy-in at the COP30. And after this session, I think it's good high-level engagement and advocacy started to reach out to the ministers who are likely to scale it, to step it down and engage more and more stakeholders. Thank you.
Thank you. So I think that's it.
Yeah.
One more, sorry.
Diego Moreno de Colombia.
Diego Moreno from Colombia. Mechanisms for funding, which include the plan, how to do it, and concrete indicators for each one of these lines.
Requested to listen, and I think that was a very nice request that we all heard. And I think we share the feeling that we've learned a lot, and it's always moving to see all this passion, all these people interested really moving the agenda with contributions, with the hope that their contributions are meaningful and are taken into consideration. And knowing the whole Brazilian team, I think they've learned, they've heard, they've listened, and they will make their best to integrate all of that into the Belém Health Action Plan. from WHO is another historic moment because we've never been so relaxed in a conference. They've really done everything, and it's really amazing to see this leadership and this movement that has been created just to move the agenda forward. For us, it's also important to see how advocacy is moving to a next step, which is really now about action, and this is the most important for us. And I think, of course, we will continue working very closely with you to try and see health as the real message that we want to use in the negotiations to get more ambition for action and for commitments to decrease the emissions. But from the ATACH, I think what we would like to make sure is that this implementation is really done at country level. We will be very happy to promote all these priorities for implementation at country level. We will be working very closely with Brazil, I think, to develop indicators that allow us to concretize all these very important statements that we heard today and all this experience that is coming from the grassroots, from indigenous communities, from Black communities, equity. So basically to move to a more concrete and not globalized implementation. So thanks so much for all of these days. Just to mention that we know that Agnes and the team are going to continue sharing this Belém Health Action Plan for additional comments, for improvement, and they will come back to all of the countries, I think, with a more concrete proposal to continue this. So from us, thanks again. Yeah.
Obrigado, Leandro.
Representante da OPAS no Brasil.
OPAS of PAHO on Brazil, Pedro Moraes. Good afternoon. I'd like for us to start keeping up with clapping. Dr. Mariangela Hagner, like the team of Ministry of Health, to be having this conference. They've done of this conference a success that it needed to be, that we needed. And also to congratulate Minister Padilla by its leadership directly, and to salute our dear Elena Villalobos from WHO, and the Svelakio leader by the Defense of Climate Change and Finance, Jaina Maramelo, General Coordinator of Adaptation from National Secretary from Ministry of Environment, to our dear Director of Global Health, Igor Barbosa, a friend of multilateralism, a great friend of PAHO. It's an honor to be with you. I congratulate and thank to the organizers and participants of the Global Conference over Climate and Health for the leadership and the compromise to building integrated answer to the climate crisis. This meeting reassures Brazilian COP30 in proportionating health in the center of the global climate action with focus on equity, social justice, and the protection of people in situations of greater vulnerability. I'll skip to. According to the World Bank, up to 44 million people may be getting into extreme poverty in Latin America only up to 2030 by the climate over health. With that, the consecutive consequences on our country, there will be economic consequences. With heat waves, floods, dryouts, it generates grave effects on mental and physical health, overlapping on the climate system, on the health system. Climate crisis is also a health crisis. The impacts are felt in a dramatic way throughout populations, provoking deaths and sufferings that could have been avoided, mainly through children and elders who perish on respiratory diseases, adults with their cardiorespiratory diseases, those who live in poor regions, in our communities, or even in further away regions, indigenous people who are direct victims of physical and mental traumas done by these extreme climate events. We cannot also forget how extreme heat augmentates, impacts the health of the workforce. Brazil will have now its conference in health of the workforce, where there will also, it must be a preoccupation, the impact generated by the climate change upon them, on the working force and competitiveness of the country. Health must be and is required to be always at the center of the global strategies, going from the moment where over 50% of the global funding is destined to health. COP30 on Amazon is an opportunity to change the situation. This global situation in climate and health gives us a moment to give the compromise of leaving no one behind and to translate the principles of equity, universality, of SUS in concrete action of adaptation and mitigation, with plans over climate change and health inspired by the discourses of this day and applied to municipality levels and local levels. It is important to highlight the objectives reached by Brazil, because Brazil is leading this movement in the region. We highlight the launching of the plan over adaptation in climate change and health, and the discussion of the plan climate and health debate plan of Belém Health Brazil plan that articulates health, environment, and equity in focus on traditional communities and people in the situation of vulnerability. The strengthening of articulation of health with our sectors, with focus on environment and climate change to a greater development.
The need to increase funding for climate change actions in health, with the inclusion of policies and interventions tackling social, environmental, and commercial determinants of health, to guarantee a stronger intersectoral governance at global and local levels, integrating both health and environmental policies within a framework prioritizing justice and development, to put the accent on protecting populations and communities in situations of vulnerability and incentivizing strong social participation. Brazil has so much to show here to the world. Temos também que estruturar sistemas de saúde.
To structure a strong, resilient health system who are also environmentally sustainable, to reinforce information monitoring, surveillance, and climate, to communicate on how these resilient ways can save lives, how can we amplify the technical coverture, and in the exchange, technical exchange, and climate funding for health, to promote climate justice with macro participation of civil society, including indigenous people and societies in vulnerable states. To make the sovereignty makes a new area with a strengthened health system who are resistant to climate events, with policies that take us to a bigger climate justice, who are fair to all. To protect health is protect the present and to protect the future. For that, and for all you might need, count on with PAHO. This is the message of our director, Jabez Barbosa, with our team here on Brazil's office, but also through our teams in Washington, led by G.V. Hman, the director of the Department of Social Determinants in Health, Daniel Push, our determinant using of environmental determinants. We have at PAHO experiments that can help identify how climate events affect the people's lives, but overall, how many lives can we save if we act in time when there are heat waves, if we build resilient hospitals, if we improve the quality of the air. Thus, how can we save life and improve life quality without leaving anyone behind, projecting experiences of countries like Brazil and others who are on the front line of mitigation action through their health systems. Thank you very much for the opportunity of following you today on COP30 and every year in what Brazil will be the president of this movement. Thank you very much, Christian. And to say the closing words of the 5th Conference on Climate and Health, we invite the Vigilant Secretary in Health and Environment of the Ministry of Health, Maria Angela Simão. Good afternoon. I see the energy is still on top. That's very good. I'm talking standing because tiny women cannot speak while sitting down. I'm going to have a mix of Portuguese and English, so whoever have difficulty, you better keep your headphones on. Firstly, I'd like to give a special thanks. I think the clapping has already been called on to the organization team, Agatha, Nami, Fernanda, Luis, Neto, guys from ISA, everyone who's worked with the international partners that helped this event to take place with PAHO and other partners. And also a big thanks to Maciel, who is our envoyee, especially for health issues, with their presence here. And I couldn't be here all the time, but I like to make a few reflections. I think the first one is that there is a big energy here, but I'd like to refer to actually we are talking to those who we are talking to those who already know of the theme, and a great challenge that we have is to live this environment and amplify this voice, each one of us, not only to our governors but to your priests, to your networks. We must know that these issues can't die. There is an effort for each and every one of us to have a compromise. While in Ministry of Health in Brazil, I think I can speak for the government, we assume the compromise of coming together with a document on the key methods and also to share a presentation on the Belém's plan so that you may utilize the PowerPoint presentation. It's not a PDF, it's for use, to be able to be used, because the idea of the plan is very good. And health and climate, I don't need to tell you, everyone's already convinced. And the second point I like to put is that it's not the moment to feel comfortable, because we leave these conversations feeling comfortable. We must be frustrated, unconformed. I think what moves the health agenda is being frustrated. But during the pandemic, I was at HWO alongside Elena and Maria Elena. But I'd say that the COVID pandemic showed that what was bad to some got even worse. I think this is the best expression of inequity. What was bad became worse for some populations. And that's what we must have clear in our agenda, that equity is not a transversive X, it's the center. Because every time you talk about this, it gets lost, it gets hidden somewhere. It becomes a subtext. No, we need it at the center. And also, it is a constatation that we are at the beginning of the beginning. It's not the beginning of the end. We are at the beginning. Because this is a new agenda for the health system, and health is a new agenda for the climate sector. So we are learning mutually. We have common objectives, and we must work on that to focus on the action, because the action of the health system is used to be able to respond faster. So we are in a hurry. It's a moment to be impatient, not patient. So just to close everything, Here are the exercise that Elena did was really good, but it's not only here that we need the participation. Both QR codes we are showing here is so that you are able to give suggestions, comments, opinions. In Portuguese, we say palpite. Please comment on this. This is the QR code for the social participation. And
synthesis, the evidence-based and synthesis of evidence-based. So we need your inputs. Mas também.
But also, I must remind you that the great is the enemy of the good. So let's focus on these comments because we must unfold with this agenda. And so that I'm able to end, I was speaking English because I've spoken of these when I presented the Belém plan. And they told me at the time that it was a Caribbean saying.
Is said and done, let us have more done than said. E acho que isso.
And I think that's when everything is done, said and done, may there be more dones than saids. And I think this is what the Brazilian government wants with this COP. We want to happen through every COP, COP 30, COP 31, and all the other ones. But that we must have the action of the health, and it may be concrete, and it may be resilient. And I think a way to be resilient, I don't know how to translate that to English, but we also say this a lot. No one will let go of anyone's hand. We are all together. And just to end, I really finish this time. I frequently have been sad, the elder ones will remember mostly. I've been quoting a phrase that was really utilized by the Front of Liberation of Mozambique, which was, the fighting continues, and the victor is certain. I say here that the fighting goes on, but the victory is uncertain. It is up to make it right. Thanks, everyone. Whoever will travel, they have a great travel. Thank you. Last photos with the participants present at the stage, an official photo, and right after the photo of these participants on the stage, we invite all to come forward so we can all participate at a photo together. And please, don't forget to give your translating devices at the entrance of the auditorium, for this is the last day of event. So now please, we invite all to join us here in the front of the stage for a collective photo. Let's please show all the energy that we've had through all these 3 days. There was a lot of union.
Tá bom. Falei pro pessoal falar. Digam COP 30. Pode?
Agora.